to these hospitals, dropping by up to 16% during urgent care clinic hours. 6 of the urgent care clinics are located in our remote communities and are working to meet the demand for services, which has seen a 9.4% rise in presentations, in addition to increased complex patient needs. These services provide care closer to home and helping ensure emergency departments remain available for those requiring the most urgent of care and treatment. Mr. Chair, restoring private maternity services remains a priority, and this government has been working to secure the future of Darwin Private Hospital to ensure Territorians continue to have access to private healthcare close to home. The loss of maternity services has had a major impact on Territory families and healthcare workers. We have been holding talks with potential operators, encouraging them to participate in the process and consider opportunities to invest in the long-term future of private healthcare here in the Territory. Our message is simple. If you are prepared to back the Territory, we are prepared to back you. As part of any future arrangements, the Darwin Private Hospital, restoring private maternity services must be a priority. In the interim, NT Health continues to work closely with private health insurers to provide alternative private models, including a hotel accommodation package and a return home sooner package. These packages provide additional flexibility and support for Territory families and include daily midwife visits, 24-hour, 7 days a week phone support, a home-delivered meals package and a gift hamper for mother and baby. The Return Home Sooner package also includes house cleaning. As of 31 March 2026, 85 families had utilised the postnatal packages, including 40 families using the hotel accommodation package and 45 families using the Return Home Sooner package. We are also continuing to invest in maternity infrastructure at Royal Darwin Hospital and have spent almost $300,000 to enhance amenities for patients and their families. This has included painting, maintenance and repair works to improve the functionality, amenity and comfort of the maternity ward. NT Health has been working to secure $10 million from the Commonwealth Government to further restore and refurbish maternity services infrastructure at RDH, and while this was considered as part of the 26-27 Commonwealth budget, no funding has been provided. When it comes to community care, mental health, alcohol policy and community treatment services continue to be important priorities. Construction of the new $94.3 million mental health facility at Royal Darwin Hospital is progressing and remains on track for completion later this year. This includes an investment of $64.3 million from the Northern Territory Government and $30 million from the Commonwealth. The facility will provide additional inpatient capacity, dedicated support services and a stabilisation assessment and referral area to improve access to mental health care for Territorians. The $58.8 million bilateral mental health and suicide prevention agreement, including $17.5 million in NT government funding, continues to deliver important services across the Territory, including Medicare, mental health centres, youth mental health initiatives, suicide prevention programs and enhanced aftercare services. NT Health and the NT Primary Health Network are also investing $300,000 to support community-led suicide prevention initiatives, with more than 239 projects already delivered across multiple grant rounds. We have also continued our work to reduce alcohol-related harm. The Health Department advised me that alcohol-related emergency department presentations have decreased during the reporting period, while community-led alcohol management plans continue to expand across the Territory. In December 2025, legislative amendments came into effect to increase 7-day police-issued banned drinker orders to 28 days to further tackle antisocial behaviour and alcohol-related crime. As of the 31st of March 2026, there were 5,212 adults on the BDR, a 25% increase from March 2025. Enhanced access to alcohol and drug services in regional, remote and correctional settings has included new treatment programs.
Point of order. I think the time's expired.
18 minutes and 20 seconds.
Well, quick then.
Programs to change behaviour and reduce alcohol harm. Mr Chair, primary health care remains the cornerstone of a strong and sustainable health system. We are also continuing to invest in disease prevention and chronic disease management. Preventing chronic conditions by addressing key risk factors is critical to reducing and managing future demand and improving the health of Territorians. The Northern Territory faces some of the highest rates of chronic kidney disease and type 2 diabetes in the world, far higher than the national average. Across the Territory, 7.4% of adults are affected, but in remote communities, that rises to nearly 1 in 3 Aboriginal adults, with Territorians 4 times more likely to be hospitalised with diabetes-related kidney disease than people living in remote communities. Mr Chair, the Territory continues to face long-standing Commonwealth funding challenges across primary health care, aged care and aeromedical retrievals, with an identified $195 million Commonwealth funding shortfall in this space. In 24-25, Commonwealth Government expenditure on aged care in the Northern Territory was $6,746 per person, substantially below the national average of $7,895 per person. Mr Chair, Territorians deserve the same access to health care as every other Territorian.
Mr Chair, time must be up
On
now.
behalf of the Northern Territory Government, thank you for your, thank you all of the staff for your commitment. I'm happy to take questions.
Thank you, Minister. I will now hand over to the Shadow Minister. Member for Gouger.
Thank you, Mr Chair. Minister, how many code yellow declarations have occurred across Territory hospitals for the reporting period?
Well, I think I said 6, I think. Code yellows.
Yeah, sure. Rather than just being told, I'd like the actual information.
Well, I think I told you, if you would have opened your ears, you would have heard that I said 6 code yellows.
I'd prefer it if your CEO gave us the information.
Gentlemen,
listen to what I have to say rather than asking questions that you already know the answer to.
I don't. I'm genuinely asking you.
Member for Gouger. Everyone will be silent. Apart from the babies, of course.
Thank you, Mr Chair. So, through the Chair, I'd like a breakdown of where those code yellows were, the locations, please.
Let me go back to my opening statement. Perhaps I'll reread the opening statement for you, Member for Gouger.
If you want to fill time and waste it, that's your prerogative.
You obviously weren't listening.
Member for Gouger, sorry, Minister. Member for Gouger, I will ensure your questions are asked with silence from everybody else, and you will give the Minister silence with his answers. Minister.
So, Member for Gouger, let me repeat what I said in the opening statement.
Sure.
Make it very clear for you. I know you're struggling to hear, you're struggling to comprehend
Point
what
of
goes
order
on in the
through
health
the Chair.
system.
There's no need for the sarcastic nature from the Minister.
Minister, I'll uphold. We don't need commentary on members of the committee as well. Gentlemen, let's have a respectful session. Minister, over to you.
Let me just reread from my opening statement so the Member for Gouger can listen. In response to high demand and capacity challenges, 6 code yellows were enacted during the reporting period, including 4 across Royal Darwin and Palmerston hospitals and 2 at the Alice Springs Hospital.
Thank you, Minister.
Thank you, Member for Gouger.
How long did those code yellows stay in place at each of those 6 locations?
Oh, I don't think I've got that information in front of me, but when it comes to code yellows...
You can take it on notice.
When it comes to code yellows, Member for Gouger, I think the important thing to understand, and as I said, when it comes to code yellows right across the board, we have the Royal Darwin in code yellow at the moment, and as I said, I was out there just last week to have a look at the
Point of order,
situation
110 relevance. I'm after a particular question. How long
that's
did
what I'm
those
getting
coded
to,
yellows stay in place for? Sharp, succinct answer would be appreciated.
So I'm not sure what the commentary is all about, Mr Chair, but I am answering the question. The current code yellow at Royal Darwin Hospital has been going since last week, and they're expected to come out of code yellow today. So when it comes to the Royal Darwin Hospital, we're talking about a period of roughly about 6 days. But I can give the detail The first one at Royal Darwin and Palmerston Hospitals was from the 9th of July, and that was lifted on the 14th of July 25. The Royal Darwin Hospital and Palmerston Hospitals experienced capacity challenges due to an increase in the number of patients requiring ongoing acute care. There was a code yellow on the 22nd of July 2025 at the Alice Springs Hospital. That was lifted on the 29th of July, so that lasted for 7 days. Alice Springs experienced capacity challenges due to complex medical presentations and an increase in patients with flu-like symptoms. On the 3rd of November 2025, the Royal Darwin and Palmerston Regional Hospital had a code yellow. That was lifted on the 10th of November 2025. The Royal Darwin Hospital experienced capacity challenges due to an increase in the number of patients requiring ongoing acute care. On the 5th of February 2026, again, Royal Darwin Palmerston Hospital, there was another code yellow which was lifted on the 10th of February. So that one lasted about 5 days, Member for Gwaja. Royal Darwin and Palmerston Hospitals experienced capacity challenges due to an increase in the number of patients requiring ongoing acute care. On the 17th of March 2026, the Alice Springs Hospital went into code yellow again, and that was lifted on the 22nd of March. At the Alice Springs Hospital, they experienced ongoing and escalated system-wide capacity pressures due to an increase in the number of patients and acuity of care required, further impacted by a severe weather event and flash flooding. On the 17th of March, there was a code yellow called at the Royal Darwin Palmerston, lifted on the 26th, so that lasted 9 days. The Royal Darwin Hospital and Palmerston Hospital experienced capacity challenges due to an increase in the number of patients following ongoing emergency responses to floods. And on the 17th of April, another code yellow, which was lifted on the 30th. So this one lasted for 13 days, Member for Gwaja. Royal Darwin Hospital and Palmerston Hospitals experienced capacity challenges due to an increase in the number of patients and acuity of care required. As I started saying before I was rudely interrupted by the Member for Gwaja, on the 9th of June, a code yellow was called at the RDH due to experiencing capacity challenges due to an increase in the number of patients and acuity of care required. So that remains ongoing, but the latest information I have is that there is a possibility that that code yellow may be lifted today. But when it comes to code yellow, Mr. Chair, as I said, I was out there last week with the Assistant Health Minister to see firsthand the work that goes on the front line, the huddle, as it's called, all of the clinicians coming together to work through access to beds in the emergency and right through the hospital, and just seeing firsthand the clinicians, the doctors, the nurses, the St John's in the ED, the number of patients there is just incredible. The work that's being done, the commitment by our staff, the professionalism of our staff going about their work under the most significant pressure is absolutely incredible, and I thank those staff.
Thank you. Through the chair, how many elective surgeries have been delayed or deferred because of code yellows across the Territory's health system over the reporting period?
Just while the Minister gets that, I'll just let the Shadow Minister know. We'll go for a follow-up question with the Member for Johnston, then we'll come back to the Shadow Minister.
Look, I'm happy to take that question on notice.
Member for Gwaja, please restate the question for the record.
Thank you, Mr. Chair. Minister, how many elective surgeries have been postponed or deferred due to a code yellow over the reporting period?
Minister, do you accept the question?
I accept the question.
The question asked by the Member for Gwaja of the Minister has been allocated the number 5.1. Member for Johnston with a follow-up question.
Thank you, Chair. Morning, Minister. Minister, what's the current process and criteria for activating a code yellow in the hospital system?
Thank you for the question, and I'll get you the answer to that. when it comes to a code yellow, the code yellow itself, member for Johnston, it's used to manage any internal incident that may overwhelm or disrupt a hospital. Each NT hospital has a code yellow internal emergency infrastructure plan which describes the emergency management arrangements and structures for an incident that is internal to the hospital and that adversely affects service delivery within the location. NT Health calls a code yellow for issues including bed capacity, which includes all hospital beds, including overflow beds, are fully utilised and no additional beds are available. It could also be called for infrastructure, IT systems and communication systems, a breakdown in infrastructure such as power loss, lifts, communication and information technology systems. As I said, all hospitals across the NT hold daily huddles where patient flow is reviewed and monitored. During these huddles, essentially it's clinicians coming together to manage capacity, demand and patient safety by enhancing situational awareness across multidisciplinary teams and identification of potential risks, alignment of resources with demand and planning for discharges. In January 2025, NT Health implemented the Demand Escalation Framework, which sets out consistent stage responses to mitigate risk to patient care and service provision and staff fatigue resulting from bed demand. At the moment, NT Health is reviewing the Demand Escalation Framework to include triggers for escalation and stand down, to improve its capabilities to predict capacity demand, for example, increase in acuity through emergency departments, increase in unexpected staff leave, and winter and seasonal surges. The review includes analysis of recent codes to identify root causes and support enhanced responses to escalate demand and reduce incidents of code yellows.
Thank you, Minister. I'm actually interested in the process of calling a code yellow. Whose responsibility is it? How does that happen?
Yes, so the responsibility, the overall responsibility is the Chief Executive Officer of the department.
And are you able to outline how many requests for code yellow in the reporting period were not actioned from within the hospital system?
Yeah, I don't have that in front of me, but I could ask Fiona Renshaw, Deputy Chief Executive, to give you some information on that question. Thanks.
Thank you. Deputy Chief Executive, Regional Health Services. I can confirm that each of the code yellows that were escalated through to the Chief Executive for that time period have been enacted.
Thank you, Ms Renshaw. So through the Minister, when you say each, does that mean any code yellow that was requested by staff had been enacted? Is that correct? Thank you.
Through the demand escalation framework, yes, I can confirm.
And can you, just in terms of the demand escalation framework, I know, Minister, you talked through that before. That's a process of assessing whether or not it meets the criteria for a code yellow. Are you able to say how many did not meet the criteria under that framework?
No, I would not. I would have to take that on notice.
Okay, yeah, that would be great.
Member for Johnston, please restate the question for the record.
How many code yellows were requested but not enacted against the demand escalation framework?
Minister, do you accept the question?
Yes.
The question asked by the member for Johnston of the Minister has been allocated the number 5.2. Member for Johnston, I will hand back to the Shadow Minister.
One little follow-up to this, which is on the same
Okay,
thing.
member for Johnston.
Thank you. What's the average time between a recommendation of a code yellow and the declaring of it? The average time and I guess the longest time as well. Thank you.
I'll ask the Chief Executive to give you some answers in regard to that.
Susan Bowden, Acting Chief Executive, Department of Health. I can give the example of the most recent code yellow where it was within a number of hours. So if it is escalated and there is a need, then it is immediately drawn to my attention. That's my recent experience, and then we respond as swiftly as we can. I think part of the work we need to do, though, too, is when we start to see some increasing pressure, is to ensure that we get public information out, that there are other options for people other than the hospital emergency ward, so that we can actually ease that pressure moving forward. I'll just check if Fiona Renshaw, Deputy Chief Executive, has anything further to that. But I feel as though, from the information I've received, that code yellows, if they're requested, they are enacted.
There is generally a lead up to enacting a code yellow, and there is a very defined process that now goes with that. So this now occurs in a very timely way with the escalation up through to myself as the Deputy Chief Executive, and a very quick flow on to our Chief Executive. So at an IMT meeting, a demand meeting, we will very quickly assess against the criteria, and once that criteria is now met, we enact that straight through to the Chief Executive to ensure a very timely enactment of the code yellow.
Thank you, Ms Renshaw. Thank you, Ms Bowden, and congratulations on your new role. And yes, I heard that code yellow, most recent code yellow, was enacted very quickly, and I heard you say now this is how it happens. I'm interested in, over the reporting period, what's the longest period of time between a request for a code yellow and it being enacted? I'm happy to take that on notice.
Yeah, we'll need to investigate that further. But when it comes to code yellow, I think we are seeing significant pressure on our emergency departments, and I think, as I've said many times, there's 60 to 80 aged care people in our hospitals. So that's 10% of our beds across the Northern Territory.
Point of order, through the chair, are we taking this question on notice, or are we just talking?
Are taken up by aged care patients, so that does affect bed flow in our emergency departments.
Member Shadow Minister.
I just wanted to clear, are you taking the question on notice around the times from when a request is met, the schedule, to then a code yellow?
The specific question is what is the longest period of time in the reporting period between a request for a code yellow and it being enacted? So not the most recent, but over the reporting period.
Happy to take it on notice, yeah.
That was the original question.
Johnston, please restate the question for the record.
What was the longest period of time between the request for a code yellow and it being enacted in the reporting period?
Minister, do you accept the question? Yep. The question asked by the member for Johnston of the Minister has been allocated the number 5.3. Shadow Minister.
Thank you. Minister, were any patients during the reporting period transferred interstate due to code yellows or bedding capacity?
Thank you for the question. I'll seek some advice on that one. I'll refer that question to Fiona Renshaw, the Deputy Chief Executive.
So what I can say is that throughout the code yellow periods that have been called, we would go through a number of predefined strategies to best put our hospital in the position to be able to come out of a code yellow. That would not mean removing or transferring any patient without the appropriate clinical assessment occurring. What we do is look to see where we may be able to return a patient to their home in a more timely way if it's clinically safe to do so. Otherwise, any transfer of a patient from the Royal Darwin Hospital to another hospital would be clinically assessed appropriately. So we would not shift a patient due to a code yellow. We would use the predefined strategies.
So just to confirm, you're saying no one has been transferred over the reporting period due to bedding capacity issues?
No.
Thank you for that question. Minister, I just acknowledge that we have some of our youngest consumers of the health system in the room. So I just wanted to ask you, the Darwin maternity ward is supporting now, I believe, an additional 250 extra births a year following the closure of the private maternity services. What additional funding, Minister, is in the budget to meet this demand, and how many additional maternity staff are being funded?
Thank you for the question. Just looking at the numbers that you're talking about. So I'll just give you a bit of a outline of some of the numbers that we have, or the numbers of births at the Royal Darwin Hospital over the last 5 years. So in 2021 there was 2,266. 2022 there was 2,110. 2023 2,008. 24 2,088. 25 there was 2,173. But up until the reporting period at the moment, we've had 2,337. So what we've seen overall is a very slight increase in the number of births at the Royal Darwin Hospital. So when it comes to capacity, happy to give you an overview of the staffing that we have, but that capacity is being managed within the services at the maternity ward in Darwin.
Thank you. So, Minister, how many dedicated staff are funded to operate the Darwin Birth Centre full time?
Look, it might be best if I give you a broader picture of how many midwives we have, because if you're talking about the birth centre itself, are you talking about the 2 birthing suites downstairs, or are you talking about the maternity ward? So maybe
Why don't you give me a breakdown of it all, eh?
Of what we have. So we have a total of 78 midwives in total, plus 17 midwives in the maternity group practice. We have 13 doctors. We have 24 beds in maternity with a surge capacity of 28. At the moment, 15 of those beds are occupied as we speak.
Right, thank you. And what's the average wait time for a ultrasound in the Royal Darwin Hospital?
Yeah, thanks for the question. When it comes to ultrasounds, I don't think I have the actual wait time, but I'll give you a bit of background when it comes to the ultrasound. Generally what happens is the women attend their GP as a first contact point when identifying they are or may be pregnant. A dating scan may or may not be offered by a GP, pending uncertainty around gestation. This scan is undertaken with a private provider. Women may also be offered a nuchal translucency scan at 11 to 13 weeks based on their risk factors. This scan provides early identification of some fetal anomalies that particular cohorts of patients may be at greater risk of. This one's an optional test, usually undertaken by a private provider. NT Health has the capacity to perform pregnancy ultrasound, however does not offer the nuchal translucency scan at Royal Darwin Hospital. RDH accepts patients from 14 weeks gestation for antenatal appointments. Women may be seen at the RDH earlier than 14 weeks if they increased risk factors that need management. Generally, some women book scans at the Royal Darwin Hospital and others book through private providers. Really, it's based on personal preference and availability.
So at the moment, it's hard for the department to be able to provide a generalised wait time.
Well, what I can say is that RDH currently performs more than 6,060 pregnancy scans per year, which is an increase from 5,086 in 2020. So
just, Minister, if I can, just to be clear, you're talking about scans. That obviously is not just limited to ultrasounds, though. It could be, I guess the next question I'd have for you is, are mothers able to request that the department do the morphology scans? Because that's a different scan, and I'm just interested if there's a wait time on that.
I'll just refer that to Fiona Renshaw, thanks.
So the scans can be offered, but the scans here in RDH can have a wait time to them. So we can refer women to the Catherine Hospital. Again, it is the woman's choice.
Sorry, can I just get you to, I can't hear you, speak up. Did you just say that there's a wait time?
There is a longer period of time for that particular ultrasound, which is done through a private provider, but women can be offered a referral and access to the Catherine provider, which they're able to access in a more timely way.
Which is, just to be clear through the chair, it's still private and private. It's not a government-funded service.
That is correct.
Okay, thank you. And just through the chair, Minister, remote women having babies for these types of scans, they can only be done in Alice Springs, Tennant Creek, Catherine, Gove, Palmerston and Darwin. Is that correct?
That's correct.
Okay, and has any studies been done to, I guess, understand what it would cost to be able to do ultrasounds in remote community clinics for expecting mothers?
Yeah, all I'd say is that when it comes to those scans, we would need to look at the data to understand what numbers that we're talking about. But these things are constantly looked at all the time. But without the numbers in front of me, the actual numbers in those remote areas is what drives demand. So that would be really.
Thank you, Minister.
A decision made based on the numbers.
Would the department would though have, through the chair, the department would have numbers, because you would pay for a repatriation into Darwin or Alice Springs or Tennant Creek or Catherine or Gove for a mother to have an ultrasound or part of the perinatal service. How much is the department spending per year on bringing remote women in for this particular type of medical service?
We would need to take that on notice. We have, obviously a number of patients travelling.
Sure.
We would need to break that down in specific to maternity, travel related to maternity.
Member for Goyja, please restate the record for the question. Please restate the question
through the chair. Could the Minister please provide a breakdown and a reflection of the costs it's costing for Territory mothers to travel in from remote locations to receive pregnancy-related health services?
Minister, do you accept the question?
Yes, I do.
The question asked by the member for Goyja of the Minister has been allocated the number 5.4. Shadow Minister.
Thank you. Minister.
Follow-up, member for Johnston.
Just in relation to the nuchal scan, you may have answered this, but the nuchal scan is not available through RDH in Darwin, is that correct?
I'll ask Fiona Renshaw to provide a bit more information on that.
Yes, sorry. No, the particular scan that you have just referred to can be offered at the 11 to 13 week gestational period based on their risk factors. So it can provide the early identification of some fetal abnormalities. So yes, the answer is yes.
It is available in Darwin?
Yes, based on risk factors.
Okay, thank you.
Yes.
Thank you.
Shadow Minister.
Thank you. Look, just I guess rounding out this area, I just wanted to know, Minister, can you confirm how many staff are currently qualified to facilitate a water birth at the Royal Darwin Hospital and the Alice Springs Hospital?
I'll just ask that Emma DeVilly, the Director of Nursing and Midwifery, come to the table, and we should be able to provide some further information for the member for Goyja.
Notice, okay. I'll take them now.
We'll take that question on notice.
Member Goyder, please restate the question for the record.
Thank you. Through the chair, Minister, how many staff are currently qualified to facilitate a water birth at the Royal Darwin Hospital and Alice Springs Hospital?
Minister, do you accept the question?
Yes, I do.
The question asked by the member for Goyder of the Minister has been allocated the number 5.5. Shadow Minister.
Thank you, Mr. Chair. I've got one last question and then I want to go to the workforce questions from your opening statement. Minister, I've just noted here that the last reporting period there were 2,107 births. This reporting period there has been 2,307 births. That's an extra 200 births. What staff have been put on to deal with those additional births, or is this being managed from within the existing staff resources?
Well, as I said, if you go back to 2021, there was 2,266. So I think on average, if we average this out, we're looking at roughly somewhere between 2,200, 2,300 over time. So at the moment, those additional births, yes, it's clear that there has been some additional births this year compared to last year. All of those births are managed within the current staffing arrangements.
Yeah, and Minister, the government has now committed $500,000 to air conditioning across the Territory Health Services because poor Territory mums were having to bring in their own fans to keep cool. Will that $500,000 fully upgrade the entire air conditioning service in all the maternity and birthing suites?
The Northern Territory government has committed $500,000 to upgrade the air conditioning at the Royal Darwin Hospital. The average, I must say, the average temperature across the hospital floors is roughly about 23.5 degrees. So at the moment, the air handling unit that services floors 2 to 7 on the A side of the hospital are the ones that are being upgraded at the moment.
Sorry, could you please confirm that?
Floors 2 to 7 on the A side of the hospital have had problems there, but essentially the $500,000 will remove and replace air conditioning coils across several hospital floors, including the maternity ward. This is in addition to work already being done to install a replacement fan for the air conditioning units.
So just to be clear, will that upgrade the air conditioning across all of the maternity suites, knowing that there are 2 suites downstairs and that you've got a ward upstairs?
The issue with the air conditioning, as I said, is floors 2 to 7 on the A side of the hospital. So that's what's being looked at the moment.
Thank you. Through the chair, how many funded nursing positions are currently vacant across NT Health?
Just bear with us, we'll get that for you.
I'll just while the Minister's looking, I'll let the committee know if anyone, I have just a follow-up maternity question, which I'll take after this one, and then we'll go back to the Shadow Minister.
Who made that ruling? Well, that's all right then.
So when it comes to nursing, at the moment what we have is when it comes to vacancies at the Alice Springs Hospital, there's a 10% vacancy rate at the moment. We after all hospitals? Or?
Yep.
So Alice Springs Hospital vacancy rate is 67.6. 10.72%, Gove Hospital 4.7%, Catherine Hospital 18.7%, Palmerston Regional Hospital 55%, Royal Darwin Hospital is okay at the moment, Tennant Creek Hospital 17.8% variance. So there's roughly about 208 vacancies across the board at the moment.
Okay, and I just want to confirm that's the hospital, but what about the hard-working health public servants in non-hospital related areas? And then I do acknowledge the chair does have a question that he'll probably cut me off for to ask.
Yeah, we'll need to take that question on notice.
Thank you.
Member for Goyja, please restate the question for the record.
How many funded positions are vacant across the Department of Health?
Minister, do you accept the question?
Sorry, just to clarify, nurses,
Yes.
yeah, I think you left out the word nurses.
Well, I'm going to come back to the other Department of Health after the chair gets his question.
The question asked by the member for Goyja of the minister has been allocated. The number 5.6. Apologies, Minister, I didn't confirm. Do you accept that question?
Of course he does.
For nurses, yes. Yeah.
Okay. Minister, my questions are quite short. It's just regarding infrastructure with maternity at RDH. Can you confirm, as of today, what federal funding has been given for maternity services here in the Northern Territory?
Well, I think it's fair to say that absolutely zero. That's the short of it, Mr. Chair, is that the Northern Territory government has been back and forth with the federal government for quite some time, and originally we asked for, we put two options to the federal government, which was a $35 million and a $10 million scenario. Basically, the federal government encouraged us to write back with a $10 million submission. We did that with an expectation that that would be funded by the federal government, but sadly, come budget time, there's no $10 million in the federal budget. I did hear commentary from the member for Solomon suggesting that in some ways this $10 million is on its way, but of course, you can't trust those sort of words saying that it's on its way. I check the mail every day and I still haven't seen this $10 million that the federal member for Solomon has promised on the radio, suggesting that it's coming, but so is Christmas, and we simply haven't seen it, Mr.
Minister,
Chair.
has the member for Solomon or the Health Minister provided anything in writing to you regarding that $10 million?
No, not at all. There's been nothing in writing to guarantee that $10 million is on the way, despite the commentary from the member of Solomon. So, look, we can't go on the member for Solomon making commentary in the media. What we can act on is a cheque produced to the Northern Territory government for $10 million. We can certainly act on that, but we can't act on speculation that the member for Solomon keeps mentioning through the media. I did try to ring the member for Solomon, but I haven't heard back from him yet. So.
Thank you, Minister. I'll now hand over to...
Chair. Sorry, I've got to follow up on
Are we done with the Dorothy Dixes or
No.
what? Come on, quick, hurry up there.
Gentlemen, I will do one question from the member...
I don't think they're Dorothy Dixes anyway.
Well, you're in the same team. I'm assuming you talk to each other, or is this the first time that you're doing it?
These are very important questions for the Northern Territory.
Minister, gentlemen.
You might not like the answer.
Minister. Okay. We will have one question from the member for Blaine. Then we will go to the Shadow Minister. And Shadow Minister, please withhold your interjections. Member for Blaine.
Thank you, Chair. I'll try to be brief. Through the Chair, Minister, can you comment on how old, like the age of the air conditioning units in question? I've heard that they're of the same vintage as RDH itself, or are they? Can you comment on how old they are?
Oh, look, I can't specifically comment how old they are, but obviously the RDH has been there for quite some time. What I would say is that, we had a Labor government for 19 out of the last 23 years, and so it's clear to me that what we have is an ageing system. There was obviously no work done by the former government. What we are doing is investing $500,000 to ensure that the hospital maintains a temperature that is suitable for all patients attending there.
Thank you, Minister. Shadow Minister.
Thank you, Mr. Chair. Minister, can you provide the number of shifts across the NT health system that were filled below the requirements during the financial year, broken down by hospital and remote clinic?
Yeah, look, we can take that on notice, but obviously it's a very broad question, and it will be quite administratively burdened. If you want to narrow the scope down at all, that's fine. But I just want to alert you now that this will take quite significant resources to find that information.
Thank you. Happy for you to take it on notice.
Member for Goyder, please restate the question for the record.
Minister, can you provide the number of shifts across the NT health system that were filled below rostered requirements during the last financial year, or the reporting period, broken down by hospital and remote clinic?
Minister, do you accept the question?
Yes.
The question asked by the member for Goyder of the Minister has been allocated the number 5.7. Member for Goyder.
Thank you. Minister, how many funded medical officer positions are currently vacant across the territory hospitals?
Thank you for the question, Member for Guajar. When it comes to doctor vacancies, there are currently 48 vacancies in Alice Springs, 12 in Katherine, 6.9 at Palmerston, 5.6 positions or FTE at Royal Darwin, at Tennant Creek. We actually, yep, and that's average year to date as at pay period 20. So Tennant Creek is fine.
Right, thank you, Minister. And how many occasions were agency nurses used to fill workforce shortages?
Well, agency nurses are used right across the board at the moment, breaking it down to shifts and vacancies. Is that you want to know how many?
I guess to thank you, Minister. To provide some context, I'd like to know how many agency nurses have been used across territory hospitals and then the remote clinics.
Yep. Now, this was a written question from your office, Member for Guajar, but nursing, when it comes to nursing, agency labour, we used during the reporting period 279 nurses, 70 medical locums, medical visiting medical officers, 12, and other 42, but a total of 403 across nursing and doctors during the reporting period.
Thank you. And are you able to provide the total expenditure on agency nursing to the end of the reporting period?
The total, when it comes to nursing, 279, is about 66,211,000.
66 million on agency nursing. Okay, thank you. And Minister, according to your answers to written questions you supplied this morning, as of the 31st of March, the Department of Health had 6,334 frontline full-time employees. That's down from 8,211 the previous year. I'm just trying to understand how Department of Health has lost almost 2,000 frontline workers in 12 months. Is there a reason for that significant decline?
I'll refer that question to Kim Charles, the Deputy Chief Executive, Enabling Services.
Thank you, Member for Gwydir, for your question. Kim Charles, Deputy CEO, Enabling Services. The reported difference is actually a change in the reporting methodology, which was reset by the Department of Treasury and Finance during the period. Perhaps a more accurate number would be the number that the agency captures for our frontline staff, which we can give you broken down in different professions, if you like.
Thank you.
So at 31 March 2025, there was 7,485. And at 31 March 2026, there was 7,724, which is an increase of 239 frontline staff.
Thank you. And just on that, how many staff worked overtime and what's the total overtime bill when it comes to our health services?
Yeah, we have some of the agency labour numbers doing overtime. I'm not sure that we've got the actual bill, but we can tell you what those numbers are that are doing overtime. I'll ask Fiona Renshaw to explain that.
Question. We've got a breakdown for the overtime and the FTE conversion by the regions, and that's from March year to date 2026. So the FTE conversion for the Barkly region is 25, the Big Rivers is 44, and we are looking at Central Australia at 129. East Arnhem was 22, we'll go to the National Critical Care Response if you would like, with 2, and I think that's the breakdown.
Thank you. Through the chair, what does that convert into a dollar value?
We'll need to take the dollar
Thank
value
you.
on notice. Yep.
Member for Gwydir, please restate the question for the record.
Thank you, Mr. Chair. How many staff worked overtime and what was the total overtime bill for NT Health by region?
Minister, do you accept the question?
Yes, I do.
The question asked by the member for Gwydir of the Minister has been allocated the number 5.8. I will hand back to the Shadow Minister. Shadow Minister, after this line of questioning, I'll just open up to see if the crossbench has any questions before morning tea. Shadow Minister.
Okay. Thank you. Minister, what was the median emergency department wait time across each territory hospital during the reporting period?
Thank you for the question. I'll ask Fiona Renshaw to provide the answer to that for you.
Thank you, and thank you for the question. The ED performance across all of our hospitals and our emergency departments for 26, with a target of 80% to depart within 4 hours, was at 46.8%. And for our non-admitted, it was 58.9%.
Great. So through the chair, how many patients waited longer than 4 hours?
We would need to take that on notice
Okay.
to get you the detail that
Thank you. Through the chair, Minister, may I read you a question and then you can determine whether you want to take that on notice or not? How's that sound?
Go for it.
Okay, well, here we go. How many patients waited longer than 4 hours, 8 hours, or 12 hours for admission or discharge from an emergency department?
It's like some of the other we can take it on notice.
That's good, thank you.
They'll be quite administratively burdensome to take that on, but we can do our best to look at that for you.
Thank you. I think this is really important information for the Territory public.
It's very important given the underfunding that we have.
Okay, thank you, gentlemen.
You
Member
need to
for
work
Goyja,
harder.
please restate the question for the record.
How many patients have waited longer across Territory emergency departments than 4 hours, 8 hours, 12 hours for admission or discharge from emergency departments?
Minister, do you accept the question?
Yes, we do.
The question asked by the member for Goyja or the minister has been allocated the number 5.9. Shadow Minister.
Thank you. How many ambulance ramping events occurred across the Northern Territory during the reporting period? You can take it on notice if you need to.
This we don't have the excuse me. We don't have the specific number, but what I can say is that St John report the presentations that were unable to be offloaded within 30 minutes. This may help you. 21% waited longer than 60 minutes, and 6% waited longer than 120 minutes. So I don't have the actual.
You don't have the data. Do you not have the ability to collect the data?
We can, so we can get. Look, the only additional information is that 72.25% were transferred to care within 30 minutes. And, if we look at that from a national average, only 50% in Australian Capital Territory, 70% in Tasmania, 47% in South Australia, 67% in Western Australia, 55% in Queensland, 65% in Victoria, 78% in New South Wales. So overall, we're doing pretty well to ensure that patients are transferred within 30 minutes.
Sure. So do you have the information on available, the number of occasions that there were no ambulances to respond immediately to calls in Darwin, Alice Springs, Katherine and Palmerston?
No, we'd have to take that on notice.
Yes, please.
Member for Goyja, please restate the question for the record.
How many occasions were there no ambulances available to respond immediately to calls in Darwin, Alice Springs, Tennant Creek, Katherine and Palmerston?
Minister, do you accept the question?
Yes.
The question asked by the member for Goyja of the minister has been allocated the number 5.10.
See, I didn't forget about the Barclay.
I'll now hand over to member for Johnston.
Thank you, Chair. Thank you, Minister. Just coming back to a question on notice from the member for Goyja in relation to staffing numbers for nurses. Could that include the vacancy number of midwives? Are you able to pull that specific information out?
Yeah, look, we'd have to take that on. Perhaps it needs to be a separate question. If you want to put the question to us, we can take that on notice.
Thank you, Minister.
Member for Johnston, please restate the question for the record.
The vacancy number of midwives.
Minister, do you accept the question?
Yes, I do.
The question asked by the member for Johnston of the minister has been allocated the number 5.11. Member for Johnston.
I'm happy to move on.
I've got a question. Thank you. Just while we're talking about patient supports and travels, you mentioned in your opening speech around supporting that process over the financial year. Minister, how many Territorians have been sent interstate to receive care that was not offered in the Territory?
Member for Goyja, during the reporting period, there were 2,975 travel requisitions for patients travelling interstate.
2,900?
2,975.
75. Thank you. And what was the cost of that on Territory taxpayers?
We'd certainly be able to find that information so we can take that on notice.
Thank you.
Member for Goyja, please restate the question for the record.
Thank you, Minister. Could you please provide the number that interstate travel for Territorians receiving medical treatment has cost the Territory taxpayer?
Minister, do you accept the question?
Yes.
The question asked by the member for Goyja of the minister has been allocated the number 5.12. Member for Goyja.
Minister, could you also provide the number it's costing Territory taxpayers and the number of people who have had to travel in from remote communities to receive health services in the Territory?
Thank you for the question. We do have the information. So when it comes to the Barclay region, during the reporting period, there was 3,099 patients travelled. Big Rivers region, 9,098. Central Australia region, 6,814. East Arnhem region, 8,744. In the top end region, there was 12,027 patients that travelled. The expenditure up until the 31st of March is $27,700,000.
Thank you. And Minister, I know that you're as interested as I am in remote health. Do you have the breakdown of de-identifying what those services were? For instance, was it to travel in for an X-ray, or was it for a surgery, or was it for an infection?
Yeah, I think, being a remote member like yourself, member for Guaja, there'd be a range of reasons. It could range from, surgery, specialist appointments, maternity. There's a whole range of things, but we don't have that breakdown in the data.
Yeah, thank you. And Minister, how many remote community clinics have X-ray machines? Or how about I rephrase that? How many remote community clinics can do an X-ray?
We can give you a breakdown of Northern Territory government-controlled clinics. As you know, there's quite a number of Aboriginal community-controlled clinics as well. We would have to take that on notice to get that detail for you.
Member for Goyja, please restate the record. Please restate the question for the record.
Minister, could you please provide a breakdown of the number of remote community clinics that are Northern Territory government operated that can provide X-rays?
Minister, do you accept the question?
Yes.
The question asked by the member for Goyja of the Minister has been allocated the number 5.13. Shadow Minister.
Minister, just wondering if you could confirm when a Territorian is sent interstate for health, the jurisdiction that they go to, do they then pick up the health-related costs while the Territorian is interstate, or do they then invoice the Northern Territory government?
Yes, they do invoice us the costs.
Okay. Could you please provide me with the invoiced costs that it has cost us to send people interstate for services?
We can try and get that data. It's not as simple as allocating that against a particular matter, but we can try and get that for you.
Yes,
Member
please.
for Goyja, please restate the question for the record.
Okay. Minister, could you please provide the number that it has cost Territory taxpayers to send people interstate? I want the number of their medical service or their medical episode interstate. So the end cost when they're sent back, what are we being invoiced? I probably have not articulated that very well right now. So what I am asking you, is what has the Territory government been invoiced for interstate health services? Was that better?
Yeah,
Okay.
we've got the intent.
Look,
I have it.
we'll do our best to interpret your question.
The question asked by the member for Goyja of the Minister has been allocated the number 5.14. We do have 5 more minutes, which I'll hand over to the Shadow Minister before we take a break for anyone that's holding
Thank
on.
you. Minister, how many remote clinics were forced to reduce services or close due to workforce shortages over the reporting period? And how many remote community clinics are currently closed?
Look, the information we have is that certainly during the weather events, Palumpa and Nayu were closed during those weather events. I don't have any information of other clinics closing during the reporting period. What I would say is that I have been to Haas Bluff, and I believe that the former government closed that service quite some time ago, and the service is being delivered from Papunya. But I'm not aware of any clinics closing during the reporting period, other than through the effect of flooding. So.
And are you aware of any clinics reducing hours due to staff shortages? Was the second part of the question.
When it comes to no, we don't have any data
Okay.
in front of us today, but we could certainly try and get that for you if you wanted that.
Sure.
Notice.
Yes.
Yep. Member for Goyder, please restate the question for the record.
Thank you, Mr. Chair. Minister, could you please confirm how many remote communities were forced to reduce health services due to workforce shortages over the reporting period?
Minister, do you accept the question?
Yes.
The question asked by the member for Goyder of the minister has been allocated the number 5.15, and I'll hand over to the member for Johnston with a follow-up question.
Thank you, Chair. Thank you, Minister. Minister, what are the current full-time equivalent staffing levels and vacancy rates in remote clinics across the NT by role or by service type?
I need to take it on notice through the chair. Just mindful of time, you know. Well, you'll be out of time at this rate.
Thank you for the question, Member for Johnson. I've got 8 pages of data. I'm happy to work through line by line if
Through the chair, he could table it.
well, we could take the question on notice and we can give you the accurate information. Thank you, Member for Johnson.
Would appreciate that.
For Johnston, please restate the record for the. Please restate the question for the record.
What are the current full-time equivalent staffing levels and vacancy rates in remote clinics across the NT by role or service type?
Minister, do you accept the question?
Yes.
And
So
sorry.
the question asked by the member for Johnston of the minister has been allocated the number 5.16. Member for Johnston.
Minister, how do actual staffing levels compare to targets in the reporting period? And my follow-up to that would be what specific measures are in place to meet those targets in going into the future?
Thanks for the question, Member for Johnson. Obviously, as a health department, our target is always to try and get to 100% when it comes to staffing. We want to ensure that. But there are obviously a number of workforce challenges right across the country at the moment when it comes to nursing and doctors. When it comes to NT Health is focused on national and international recruitment campaigns to attract suitably qualified health workforce and in turn reduce the obviously the reliance we spoke about before on agency and locums. Some of the specific initiatives we have at the moment include participating in the NT Government Global Worker Attraction Campaign, promoting NT Health work opportunities. For example, generated more than 40 leads in April 2026 through a UK and Ireland event. We have more than 100 registrations for healthcare work opportunities from June 26 from a Melbourne event and planning NT Health delegation for further events. So we are actively constantly running recruitment campaigns to ensure that we do have 100%. We have partnered with a specialist recruitment provider, CCM Recruitment, to source skilled nurses and midwives and pharmacists from domestic and international markets. Since March 2025, for example, more than 200 nurses and midwives found suitable, of which 17 commenced and a further 40 will commence by December 2026. 5 pharmacists recruited, of which 2 are commencing this month. But ongoing recruitment processes are ongoing. Obviously, we have promotions of all available employment options, whether that's casual, job share, fixed term, part-time and ongoing. So we are actively working through that. We have strengthened the NT Health value proposition through relocation and accommodation support across all health professions for both domestic and international students. We have recently seen improved retention of junior medical workforce from 49% to 70%. So all up, there's constant recruiting, constantly focused on attraction and retention right across the workforce, and we'll continue to do that. The reality is that we're in competition for health services right across the country at the moment.
Thank you, Minister. And can I just confirm, that that the question on notice will answer the other part of my question, which is what is the comparison between targets of employment and the actual employment? That would be covered by my question on notice. Thank you. Yeah.
All right, thank you, ladies and gentlemen. We'll now break for morning tea. The time now is 10:32.
10 minutes,
return at 10:47 for a 15-minute break.
10 minutes
Thank
would
you,
be better.
Minister. We've done 15 minutes every day. We'll be sticking to the same
Oh, look, he's
schedule.
chomping at the bit to stay here. I'm happy with 10.
Member for Goyge will be very happy because we're kicking off 2 minutes earlier.
Oh, there we go.
What I will do is I'll hand to Member for Johnston with some follow-up questions. I'll then go back to the Shadow Minister. I then have some questioning on the Palmerston Hospital specifically, but I'll do that when the Shadow Minister has finished his line of questioning. Member for Johnston.
Thank you, Chair. Thank you, Minister. Just a couple of follow-ups from some of the questions this morning. With elective surgeries, Minister, could you give the breakdown on wait times by specialty and category for elective surgery?
Given the question relates to a breakdown for each specialty, we'd need to take that question on notice.
Thank you, Minister.
Member for Johnston, please restate the question for the record.
Can you please give the breakdown on wait times by specialty and category for elective surgery?
Minister, do you accept the question?
Yes.
The question asked by the member for Johnston has been allocated the number 5.17. Member for Johnston.
Thank you, Chair. Thank you, Minister. Minister, what's the average wait time a patient waits for a bed on a ward after being allocated one by ED?
Thank you for the question. I'll ask Fiona Renshaw to provide you the details of that.
Thank you for the question. So the wait time for admission following being triaged in an emergency department is within the same defined definition of the emergency department within 4 hours, directly related to admission. So that is variable depending on the acuity of the patient, the triaged assessment, and their ability to be able to admit to the specialty ward that's required. So I'd need to have, I could answer that if I have the defined admission that's required.
The defined admission as in what kind of admission it was?
Yes.
What category they were admitted under? Is that the terminology you use?
Yes.
Is that enough information?
Yes,
Yep.
yes, of course.
And just one other. Do you need that on notice, or can you answer it? I need it on notice. Yeah.
Member for Johnston, please restate the question for the record.
What's the average wait time a patient waits for a bed on a ward after being allocated one by ED, broken down by specialty?
If that's what you would like. Otherwise, we do have the data for the admissions within 4 hours, and that is as reported for 25-26 at 46.8%.
Thank you. I'd like the whole question.
Minister, do you accept the question?
Yes.
The question asked by the member for Johnston of the Minister has been allocated the number 5.18. Member for Johnston.
Thank you. Sorry, just one other follow-up question on behalf of a constituent. This is about the nuchal screening. I just wanted to clarify, you said it is available in Darwin. Is that through the public health system? Through the Minister, sorry.
Sorry, can you just repeat that question, please?
In relation to the nuchal scan, I think earlier we heard that is available in Darwin. I just wanted to clarify that it's available through the public health system in Darwin.
Yes, Fiona Renshaw can answer that question.
Yes, thank you. It's as previously mentioned, it is due to the high risk. So if there is a presentation to the emergency department, that would be facilitated at Royal Darwin, yes.
Okay, thank you.
Thank you.
Shadow Minister.
Minister, I know the member for Johnson has asked a question that you've taken on notice around elective surgeries. I'm wondering if I can ask, are you able to provide that breakdown via the regions of elective surgeries? Because I think, member for Johnson, you've asked it for an overall number. Could I just ask that as a regional? So I guess in the reporting period, how many elective surgeries across the territory, that number?
And And just, you're asking by region.
Yes.
We'd have to take that on notice.
Member for Goyder, please restate the question for the record.
Thank you. Minister, across the reporting period, could you please provide a breakdown of the elective surgeries by region?
Minister, do you accept the question?
Yes.
The question asked by the member for Goyder of the Minister has been allocated the number 5.19. Member for Goyder.
Minister, could I please get a breakdown of how many Aboriginal Territorians are employed in the Department of Health?
Just while we're finding the data, I might, we do have one of our officials, Samara Hanley here, might just ask her to come forward and provide some questions. Samara is the Executive Director, Aboriginal Health Engagement and Workforce.
Thank you, Minister, and thank you, Member for Gouaja. We currently have 599 First Nations members working across the Northern Territory.
Great, thank you. And Minister, how many funded Aboriginal health practitioner and Aboriginal health worker positions are there in the Northern Territory government?
Yeah, look, we can provide a breakdown of that. Certainly when it comes to Aboriginal health practitioners, we have 62 at the moment. And I can ask...
thank you very much for answering, but I just want to know how many are funded,
Right.
how many are vacant?
Sorry, we have, according to the information in front of me, and I'll ask Ms Hanley to give some further information, but when it comes to an Aboriginal health practitioner, the information I have is 63 and we have 62 at the moment, but I'll ask Ms Hanley to give some further information about that.
Thank you, Minister, through the Chair, and thank you, Member for Gouaja. The approved FTE for First Nations is 134.53. We currently have 62 Aboriginal health practitioners, and we currently have 118 vacant.
118
Yes.
vacant? Okay. And just to be clear, that's Aboriginal health practitioner,
Yes.
not Aboriginal health worker?
Correct.
Okay. And do you have the numbers on the health workers?
I can get that for you.
Thank you. And do you need to take that on, through the Chair, does that need to be taken on notice? If so, I will do that.
Yeah, we'll have to take that one.
Member for Goyder, please restate the question for the record.
Yep, remember what I was asking. Minister, could you please provide the number of Aboriginal health workers, the funded number, the actual number and the vacancy?
Minister, do you accept the question?
Yes.
Thank
The
you.
question asked by the member for Goyder of the Minister has been allocated the number 5.20. Member for Goyder.
Thank you. Minister, how many Aboriginal liaison officers and interpreters are funded across NT Health?
Yeah, thank you for the question. I'll ask Ms Hanley to provide some information about that.
Thank you. Thank you, Member for Gouaja. The actual numbers for the Aboriginal liaison officers and interpreters, I do not have close by, sorry.
We can certainly break that down further, but you know the information we have is, you know, we've got around about 600 Aboriginal employees in the department at the moment, so we can get a breakdown of positions if that's helpful for you. So.
Sure, that would be great. Thank you.
Yeah, I'll just first. Would you like that on notice, member?
You have to take it on notice, yeah?
Yep. Well, we can look the information. We can give you the broad information of each position I've got that in front of me. So we have, as of 31st of March 2026, we have 62 Aboriginal health practitioners, 290 administrative employees, one executive contract officer, 39 medical, 71 nursing, 94 physical, 22 professional and 20 technical. We're bringing that to a total of 599 Aboriginal employees.
Thank you. And Minister, with your interpreters, are they NARTI qualified?
I'll ask Samara Hanley to provide some information about that.
Thank you, Minister, and thank you, Member for Gwaja. We do have interpreters, and the majority of them are NARTI qualified.
Great, thank you. And through the chair, when we're talking about the Aboriginal health practitioner and the Aboriginal health worker, what's the ratio urban versus regional or remote? Minister, do we have that number?
I'll have to take that on notice. We don't have that breakdown in front of us.
Member for Goyja, please restate the question for the record.
Minister, could you please provide the ratio of Aboriginal health workers and practitioners, urban, comparison to remote?
Minister, do you accept the question?
Yes.
The question asked by the member for Goyja of the minister has been allocated the number 5.21. Member for Goyja.
Thank you. Minister, I am just wanting to understand from your position, are you intending to commence building a new Darwin hospital this term of government?
Yeah.
Yeah, we're still in the opening statement.
I will just remind on the question that a question should not ask the minister to announce new policy of the government, but may seek an explanation regarding current policy and its application.
Minister, is your department currently in the planning stages of building new hospitals in Darwin, Katherine and Alice Springs?
Thank you for the question, Member for Gwaja. I'm not sure that I mentioned it in my opening statement, but happy to answer your question, given that it wasn't part of the opening statement. But what I can say is that Mr. Chris Hosking has commenced in a new role as the Executive General Manager of Strategic Healthcare Investment, which will lead the establishment and function of the that health investment. So, look, the role will focus on developing more long-term strategic infrastructure plans, particularly addressing health structure needs across the territory. Look, as you know as well as I do, we've seen significant ageing infrastructure right across the board, not only our hospitals in the regional centres, but particularly in remote, we have a number of ageing health clinics in the regions as well. So the work that he'll be doing is developing a long-term master plan to guide future infrastructure, service delivery, and to look at system capacity across the territory over the coming decade. The question around the specifics, are we building a hospital? I think the short answer is no. We've got 2.5 years left in our term of government. No hospital could be built in that term, so in that short time frame, I should say. But what we are doing is looking at the long-term infrastructure needs of the Northern Territory when it comes to all of our regions and all of our remote areas.
Thank you. Through the chair, just providing some context. The reason why I'm asking about this infrastructure is because in your opening statement you spoke about the pressures on patients and on staff in the current network. So the position that Mr. Hosking has been put in to do this work, could that not have been done with the already internal staff whose job it is to look at critical infrastructure and planning?
Look, this is a big piece of work, and it's work that's been neglected for a number of years, particularly under the former Labor government. These issues have been long-standing issues for a long, long time. It's a big piece of work. We have a number of as I said before, ageing health clinics right across the board. This requires some dedication and commitment from a position to really focus on getting to the bottom of these issues, because particularly in remote areas, as you know, it's not just the health clinic. There's housing needs as well that go with that. So we need to look at how best we can deliver health services right across the Northern Territory over the next 5, 10, 15 years. So we do need a strategic infrastructure plan to do that, and having a person dedicated to that is a significant investment by our government, because these long-standing issues, it's not just the infrastructure, but we face some long-standing issues right across the Northern Territory when it comes to funding as well. And as I say quite often, we're $200 million short from the federal government, particularly, we have aged care, long-stay patients in our hospitals, which is costing the Northern Territory $40 million a year, which is a federal government responsibility. We're also $95 million short when it comes to remote primary health care. And we're currently paying...
Point of order through the chair. This is a particular question. Appreciate a succinct response by the minister, who's giving me a novel. I don't want the novel, I want the answer.
Stop. Okay, there will be no interjections. Minister, have you finished asking the question?
So, no, I haven't finished answering. I'm trying to answer, but there's interjections coming from the other side of the room, which are quite disturbing. I'm not sure why they don't want to hear the answers to this, but when it comes to health in the Northern Territory, the infrastructure is ageing, the funding is declining. There's some significant impacts on our health system right across the Northern Territory. As I said, we're roughly $200 million underfunded just when it comes to primary health care, aeromedical services and aged care. That's without looking at other funding agreements as well. So the work that Chris Hosking will do, particularly around infrastructure, is very important for the Northern Territory.
So through the chair, Mr Hosking has taken on this role. As part of that role, will there be identified sites in the Northern Territory to build new hospitals?
Look, Mr Hosking has been in that position one day.
Yeah, so point of order. I'm not actually... Mr Hosking is not the person I want to talk to.
I'll make a ruling on this. As there hasn't been any announcement as such of any new infrastructure, it would be considered a new policy of government. So I will rule it out on that ground.
That's fine to rule it out. Part of the role that this individual will be undertaking is part of that role looking at part of the planning process around the future of health services in the Northern Territory's locations.
Look, of course it is. When you look at health needs across the Northern Territory, we need to look at where best to deliver health services from right across the Northern Territory, whether that's remote, regional, or whether it's our capital city in Darwin. We need to ensure that we do the proper strategic planning, which was never done under the formal Labor government. I don't know why it wasn't done. We're getting on with the job. We're doing the work that's necessary to ensure that we have health services in the Northern Territory that will deliver for our population for the next 5, 10, 15 years. As part of that planning and assessment of current infrastructure, of course, what we need to do is identify where best and location-wise, where best should those services be delivered from.
Thank you. So part of that role will be...
Goja, I'm just going to hand to the member for Johnston, who did have a follow-up on a previous question.
Thank you, Chair. Just in relation to this new position, what funding has that new role been given, new role and project been given, and where is that in the budget?
Yeah, the funding for the position is from within, and the position will sit with Treasury.
Are you able to say what the amount is?
That'll be a question for Treasury. Thanks.
And just two other quick follow-ups from previous things on behalf of the member for Mulka in relation to interpreters. I think you gave a breakdown of Aboriginal staff, but not specifically interpreters. Are interpreters embedded in the hospital system? On behalf of the member for Mulka.
Thank you for the for the question. AIS provides a rostered interpreter service Monday to Friday from 8:30 to 12:30 at the Royal Darwin Hospital. Languages available vary according to workforce availability. NT Health additionally funds the Aboriginal Communicating for Safety interpreter service, which comprises 6 part-time interpreter positions, and they also operate Monday to Friday.
Thank you. So the second role you described is embedded in the hospital.
right.
The other are AIS staff.
That's right.
Is that correct? So how many FTE interpreters are embedded in the hospital system? On behalf of the member for Morka, just to be clear.
So you're saying just RDH, the number of interpreters
Yeah.
embedded at the hospital at RDH? 6.
Thank you. And just one other follow-up question just in relation to hospital infrastructure, also on behalf of the member for Morka. For the 2026-27 budget, are there any increases or losses for the funding of the Gove District Hospital?
There's been no change. The money on the program at the moment is for the upgrade of the fire system at the Gove Hospital.
Thank you.
Yeah, I'll now hand back to Member for Goyja. Member for Goyja, once you've finished your current line of questioning, I will take just for some electorate-specific ones for myself. Member for Goyja.
Minister, just on the position that has been taken on around planning, will this position produce records on the lifespan of Northern Territory health infrastructure, being buildings, and will it also provide lifespan on critical health-related infrastructure, CT scanners, PET scanners across the Territory?
Look, as I said, the investment priorities and long-term healthcare master plan is really to guide the future of infrastructure, service delivery and system capacity across the Territory over the coming decade. So, look, the main focus is on the infrastructure at the moment, and that's what the focus will be on.
Thank you. So how much funding has been allocated to produce a master plan?
That's a matter for Treasury.
How can it be a matter for Treasury? Aren't you the health minister? Isn't this health infrastructure?
I just said that.
You're dodging the question again, are you?
Gentlemen,
I think there is something wrong. You can't seem to hear what I'm saying.
No, you can't seem to answer a simple question.
I did say this before.
Health infrastructure is not a matter for Treasury, it's a matter for you.
I did say
Health infrastructure is your job.
Listen,
Member for Goyja. We will do this respectfully. We have staff here. We are going to maintain discipline in this committee and not speak over each other. Now, the position is clearly, as stated, in a different department. Questions will relate to this department. I will hand back to the Shadow Minister. Shadow Minister.
So, Minister, again, is there funding within the Department of Health to produce a master plan?
the funding sits with the position. We've put a senior public servant in the position, and his role is to develop the infrastructure.
So can you, Minister, provide me of a breakdown? How much of that is for wages? How much of that is to produce a master plan?
That'll be a question for Treasury and Finance. As I said, the position sits there. The position is responsible for developing the infrastructure master plan.
So just to confirm, this is an actual health-funded position and project, yes? So you would already have the money in health?
As I said once more, the position sits in Treasury. The position has a specific piece of work, and that's to develop a health infrastructure plan for the Northern Territory.
Okay, so given the ongoing health workforce retention crisis that we're having, exactly how much of the $18.3 million, Minister, of the annual operation budget is projected to be absorbed by agency nursing and locums rather than the creation of new frontline positions?
What I would say is that it's not about replacing frontline positions, it's about filling positions that we can't fill. So I think we've already spoken about the number of agency positions that have been in the Northern Territory, so I'm not sure really what information you're after beyond what we've already spoken about.
And I will just come in as the line of questioning has changed, Member for Goyja.
Point of order, it's still related to health infrastructure.
Yes, Member for Goyja, I'm going to come in and ask a couple of electorate questions and then I'll hand back to yourself. Minister, my questions are going to be just related to Palmerston Hospital, and so all the following questions will be related to Palmerston Hospital. How many ED admissions over the reporting period did we see at Palmerston Hospital? But importantly, I want to try and make that number make sense to me. So is there a national figure or something I can compare that to so I can understand what the demand is at the Palmerston Regional Hospital?
Thank you for the question, Mr. Chair. What I can tell you is that when it comes to ED presentations in hospitals, what we have seen is quite a substantial number through Palmerston. Just for 24-25, 32,345 presentations. That's been fairly consistent for a number of years. If we go back to 2021, there was 34,101. 21-22, 32,493. 22-23, there was 32,965. So, and 23-24, 31,762. So we have seen a consistent number coming through Palmerston. So for 24-25, 32,345. A comparison, for example, against the RDH at the same time, RDH had 68,862. So
Can that number be given as like a per capita rate? I'm just wondering, because the reason I'm asking the question, it's try to establishing demand through Palmerston ED, and then I guess the resourcing required, or even to understand if in Palmerston we're having much higher emergency presentations per person. I'm trying to establish that fact, and then potentially what needs to be done with primary health, etc., to alleviate that pressure. So it's trying to understand what is our, I guess, per capita admission rate for Palmerston.
Look, we could certainly look at what data we can collect in regard to that, but when it comes to Palmerston, the ED, depending on the acuity of care, some patients may need to go directly to Darwin anyway if it's a significant matter which might involve ICU, for example. We do have the urgent care clinic at Palmerston. We can obviously do some analysis around what numbers have been through the urgent care clinic versus the Palmerston ED. We can look at that sort of information, but when it comes to per capita, it is difficult to pull that together given that a number of patients may go directly to the Royal Darwin Hospital Emergency Department.
Okay, are you happy to take on notice potentially what is the demand proportionate to a national average for Palmerston Hospital ED?
We can certainly take that on notice, Mr. Chair.
The question, I will restate the question for the record. Minister, can you provide figures as to the demand pressures on Palmerston ED and compare that to either national or other Northern Territory ED demand figures?
Yes.
Thank you. The question asked by the member for Drysdale of the Minister has been allocated the number 5.22. Minister, what specialist services are available at the Palmerston Regional Hospital?
Thank you for the question. There's a number of services delivered through the Palmerston Regional Hospital, emergency medicine, general services, medicine, surgery and critical care, women's, children and youth. But what I'll do is I'll ask Fiona Renshaw, the Deputy Chief Executive for Regional Health Services, to give a broader breakdown for you.
Thank you for the question. I think what I'd really like to highlight for the Palmerston Hospital is the expertise that's attributed to the aged care services, and we have a number of geriatricians there and nurse practitioners through to nursing and allied health and doctors. So what I have seen at the Palmerston Hospital from a specialty point of view is Palmerston Hospital's ability to be able to support our aged care services. But we do have a number of specialties associated with our theatres and other areas of specialty.
Thank you. Are you able to, are you happy to, I'm happy if there's a tabled list or provide on notice the specific specialties that are available at the hospital. Are you happy to take that on notice?
We can take that on notice.
I'll restate the question for the record. Minister, could you please provide a list of specialist services available at the Palmerston Regional Hospital? Minister, do you accept the question?
Yes.
The question asked by the member for Drysdale of the Minister has been allocated the number 5.23. Final question, Minister, you spoke of the impact aged care services is having on the health system. You stated 40 million a year. Is Palmerston Hospital carrying some of that burden as well?
Yes, thank you for the question. And long stay patients, as we know them, aged care people, are unfortunately there's roughly anywhere between 60 and 80 a day across the Northern Territory that are staying in our hospitals because of the absence of aged care facilities in the Northern Territory.
And Minister, if interstate jurisdictions bill us for health services, do we bill the federal government? Have we billed the federal government for the overflow in aged care, being the federal responsibility, but the NT health system picking up the bill? Have we ever billed the federal government for that cost?
When it comes to actually a bill, so to speak, there's been plenty of discussions with the federal government around the cost of 40 million. What we are seeing nationally, and it's an issue that comes up through health ministers' meetings right nationally, and the average is 10% of hospital beds right around the country at the moment are being filled by long stay patients, which is aged care people with nowhere else to go. So it's 10% of beds right across the country at the moment. In the Northern Territory, it's costing us 40 million we've had many conversations with the federal government and so have the other states and territories around the cost and the impact that it's having in the states and territories. And just before we spoke about code yellows, and code yellows come about many times because of the lack of access to a bed. 10%, we've got roughly 800 beds in the Northern Territory. Roughly 80 of those are filled with aged care people that should be in better facilities in the Northern Territory. But the federal government has announced recently that there will be a new facility built in Darwin. We've offered the Palmerston grounds as a place where that can be built, and we've also committed to funding the headworks of that particular facility. But when it comes to an actual bill, $40 million, and we're constantly having conversations with the federal government about that.
Thank you, Minister. One follow-up, members for Johnston, and then it will be the Shadow Minister.
Oh, thank you, Chair.
Thank you, Chair. Minister, in relation to Palmerston Regional Hospital and the hydrotherapy pool, what's the current level of access and use of the hydrotherapy pool, including operating hours, patient numbers, referral volumes and wait times?
Thank you. Excuse me. Thank you for the question. The Palmerston Regional Hospital hydrotherapy pool provides critical allied health care for both hospital inpatients and outpatients. This includes those who require cancer, orthopaedic or paediatric therapy, as well as long-stay patients who have complex rehabilitation needs and geriatric patients who need ongoing management and care. Casual classes and private provider usage was previously introduced to the Palmerston Regional Hospital to provide temporary respite while facilities at the swimming pool facilities in Palmerston were undergoing refurbishment. The Palmerston Regional Hospital returned to normal operating arrangements as a hospital pool on the 28th of February 2025. When it comes to referrals can be made by eligible people to use the facility by a medical specialist, a GP or a private practicing allied health professional. All referrals are assessed by NT health clinicians, and if eligible, the individual becomes an outpatient of the Palmerston Regional Hospital and is scheduled for a block of goal-directed therapy. The therapy block can be extended if needed. There's also a range of other services that provide heated pools and rehabilitation swimming areas for the community in Darwin and Palmerston. For example, the Darwin Private Hospital also has a hydrotherapy pool for use by private inpatients and outpatients.
Thank you, Minister. Are you able to share the hours, the operating hours, the numbers, patient numbers actually using that facility, and the referral volumes and the wait times for people?
Thank you. I haven't got the operating hours in front of me, but in 2025, the Palmerston Regional Hospital hydrotherapy pool recorded 1,606 inpatient and outpatient attendances, averaging approximately 30 visits per week.
Thank you, Minister. Are you able to share the wait time for a referral?
I'll just hand over to Fiona Renshaw to provide further information about wait times.
Thank you, and thank you for the question. And what I would say is the wait time is variable against an outpatient and an inpatient, and is also variable given the clinical need and assessment. But my understanding is, and I do check in on this regularly, that the wait times are minimal at present for inpatient. The outpatient may be variable just depending on clinical need.
And minimal means?
Within a 2-week period from a clinical perspective, yes.
Thank you. And through the Minister, when changes were made, you said that at one point this was available for private allied health use and the community. What consultation did you do before you made those changes?
When it comes to consultation, all of the participants at the swimming pool, at the hydrotherapy pool, I should say, were advised about the changes, and I'll ask Fiona to expand a bit on that.
Thank you. Just to be clear, advising isn't consultation, Minister.
We're not having arguments or pop shots. So, sorry, Ms. Renshaw.
Thank you. And again, thank you for the question. So consultation was undertaken, and it was undertaken particularly at that point of time internally with the key stakeholders, and that did include users of the hydrotherapy pool. I think on review, I think what we should do and moving forward is always look to consult with our community and our user groups more broadly.
Thank you. I will go to the Shadow Minister, who's waiting very patiently. Shadow Minister.
Oh, thank you, Mr. Chair. Minister, I just wanted to touch on the mental health impairment unit. I acknowledge that you made an announcement recently around 24 beds. I'm just wanting to confirm, you said that there were 24 beds and a 6-bed stabilisation assessment area.
18 plus 6.
So it's 18 plus 6 to make the 24. Thank you for qualifying that. I just want to understand what the model of care in the new ward is and how it's going to create that seamless step that everyone's talking about.
Well, what I would say, it hasn't opened yet. So,
Yep.
But what I'll do is I'll ask Cecilia Gore, the Deputy Chief Executive, to provide an update on what that latest care model will look like once the new facility is open.
Thank you.
Thank you, Minister. Cecilia Gore, Deputy Chief Executive, Commissioning and System Improvement. The team at the Royal Darwin and Palmerston Hospital is working through that model of care now. I think the two key things to note are that the new beds will form part of the overall service. It's one service provided in 4 different wards, if you like. And so the idea currently is that the 6-bed short stay or stabilisation referral area will enable people to come in for up to 3 days and to have a non-ED environment where their needs can be assessed better. That then will result in the clinical teams working out what is the best placement for those people across the 3 different areas. The new build will be the primary admit point for the majority of patients coming into the hospital. The JRU, which is the Joan Ridley unit, will continue to be the secure area for those people who are either involuntary patients or who've been transferred in from other custodial settings. So it's a secure unit. And Cowdy Ward, which is currently the main space, the team are currently working on the ability for that space to move more into a longer-term, slow stream rehabilitation mode, so that with an increase in overall bed numbers, the pressure for people to come in and then be discharged so that there's availability will be reduced, and Cowdy Ward potentially becomes a place where a longer-term stay is enabled. That will be continued to work through. The team's been working through the data, looking at demand from remote areas, the demand for young people, and that we've still got a few more months to get the flow charts exactly right.
Yeah. Okay, thank you. Minister, in August, 30th of August 2024, the Northern Territory Government put a contract out for safe drinking water in the Northern Territory. What recommendations have come out of that report?
Thank you for the question, Member for Kawarja. I'll ask our Chief Health Officer, I should say, Dr. Paul Burgess, to provide you some further information about that.
Great, thank you. Paul Burgess, Northern Territory Chair Staff Officer. Thank you for the question. I'll put the mic on. Thank you for your question, Member for Kawarja. We have a collaboration, I guess, with the Power and Water Corporation and Department of Lands and Planning and Environment. We are committed to safe drinking water for all Territorians. A Territory Water Plan 2023 to 26 set out a 3-year approach for strategic water policy to strengthen NT's long-term water security. There are commitments in that plan for safe drinking water, and the details of that plan, we're working with other NT agencies, including Department of Lands, Planning, Environment, Power and Water, to partnering the National Water Grid to invest in water infrastructure projects that deliver safe drinking water to homes. Close to 140 million is now secured, and projects being delivered in 18 remote communities across the NT. This year, funding is being secured for water supply projects in Galawinku and the Go Peninsula, with better bores for communities completed in Gapawiak already. Developing regional remote community water infrastructure that list for continuing capital delivery and providing greater transparency about what works are being considered. Improving water security outcomes for Aboriginal homelands through the delivery of a knowledge program to build the capacity of water service providers is also part of that plan.
Thank you. So through the chair, there is currently work underway for a Safe Drinking Water Act. Is that right, Minister?
No, it has been mentioned, I think, at last estimates. What we do have is a drinking water quality is in the NT is managed through a memorandum of understanding through the NT Health, Power and Water Corporation and Indigenous Essential Services.
Right. So how many communities across the Territory would be currently considered by the Department of Health at risk because of their water quality?
I've got that one here, I think. Thank you, Minister. Member for Goyja. Paul Burtis, Northern Territory Chief Health Officer. NT Health is the effective regulator with the Power and Water Corporation, where we operate under a memorandum of understanding around water quality. And we have a number of communities that are currently, we are working in a collaborative fashion with Power and Water Corporation to improve water quality. I have in front of me a table here with 7 communities where there's currently water issues that we are working collaboratively to secure and improve water supply as part of that improvement program.
So through the chair, Minister, is the Department of Health level of concern or risk for these communities great in terms of implications on their health because of the quality of their water? Thanks.
I'll ask the Chief Health Officer to speak about those 7 communities in regard to the quality of water and any health issues with that.
Thank you, Member for Gorgeous. Thank you for your question again. I can work through those communities with you. Firstly, I think we spoke last year about Alpurulum and Europe that have minor exceedances of fluoride in the water. Fluoride is an important part of our water system in terms of dental health. In these 2 communities, naturally occurring fluoride in the water table is slightly higher. So bottled water has been provided in those communities, and that is under our that is for young children and also for pregnant mums. And in more recent times, there's been a noted exceedance of barium in the community of Bulla, where they have increased barium in their water supply. Barium's not an acute health risk, but over a long-term exposure can provide some minor health risks. We actually use barium in a lot of our medical procedures in our hospitals. However, again, we're working collaboratively with the community of Bulla and also the Power and Water Corporation to provide alternative water supply while we work through the technical issues of improving the combination of groundwater and also surface water to have a safer, potable drinking water supply for that community. There are minor exceedances that may be also measurement errors in the communities of Tea Tree, Woollowra and Woolglar. And so those, again, those three communities under constant regular monitoring with Power and Water Corporation, and where we see exceedances, which sometimes are temporary, we're providing alternative water sources while we work on longer term technical fixes with the water plants to have safe water supply.
Thank you. So just to confirm, Minister, is it only 3 communities that are being supplied bottled water at the moment of the 7?
We have Nirrupi, Aparulam and Bulla, and those are the ones where we have, to my knowledge, we have those alternative water supplies. The other ones we're undergoing monitoring programs and working again with Power and Water Corporation to get the technical water plant solutions in place. Because those exceedances are fluctuating, but are sitting around, I guess, the limit where we would start to think about alternative water.
And through the chair, we have high rates of renal failure in remote and regional locations. Is work being undertaken to understand if what's causing that is also through remote community water?
Yes, thank you for that question, Minister Gorgia. I've been a long-term health practitioner in the Northern Territory for decades in remote regions of the Northern Territory, and it's a good question. We see a large proportion of our renal dialysis patients actually coming through diabetes as a really important predeterminant of renal failure rather than the potable drinking water supply.
Thank you. And if I may, through the chair, Minister, while you have your Chief Health Officer here, are you able to provide us with the context of what the current vaccination rate across the Territory is?
Vaccination rate for diphtheria?
Happy for diphtheria, but I just want to understand if we're noticing a decline in overall vaccines across the Territory.
So it's a general question, not about any specific.
Well, you've given me the chance now because you've asked me about diphtheria, so I'm going to ask you about it as well.
We have that information ready for you.
Oh, look at that, ready to go. It's like you thought I was going to ask you. But can I just start with the overall vaccine rates and then go to diphtheria?
Yeah, I'll hand over again to our Chief Health Officer to provide that information.
That's fine. Thank you. That's 4.1.2, isn't it?
Just while that information's being collected, I'll let everyone present know we will have a toilet break within the next 10 minutes.
Great. Thank you, Member for Gorgia, for your question. Again, Paul Burtis, Chief Health Officer. Just to address your question globally around vaccination, we've had historically a very strong vaccination program, particularly in our remote communities you'll be familiar with, where our rates historically have been very high, in fact have been some of the best in the country. And that's been a strong participation of Aboriginal and Torres Strait Islander Territorians, and certainly a lot of hard work by our remote primary healthcare teams in particular. Sadly, around the globe and also nationally through the advent of the COVID-19 pandemic, we did see an explosion really of disinformation and misinformation around vaccination and a lot of fear. And what we have seen, sadly, globally, is falling vaccination rates, and the Territory is not no exception to that. We've seen declining vaccination rates now at about a 5-year-old cohort, which was one of our key performance indicator targets. We see vaccination rates now sitting around 90%. Previously, they were around 95%. So we have some work to do in terms of working with communities, working with messaging, and also working very hard with our primary healthcare staff to increase those vaccination rates.
Yeah, and are we seeing, through the chair, are we seeing a decline across the board in terms of other age groups as well?
Yeah, thank you through the chair, but also thank you for that question. The short answer is yes. I think we did see that again. We're seeing that again nationally and in every state and territory with vaccine fatigue is a phrase that's often used to explain this phenomena where people had many vaccines during the COVID pandemic and then were reluctant to do so, to continue. We do have many immunisation programs. We participate in the National Immunisation Program, the Northern Territory. Under the CLP government, we had an additional program for meningitis B vaccine that's had quite a successful rollout. To talk briefly around diphtheria, many of us, in fact, the vast majority of us, have had a primary vaccination during our childhood and adolescence through the National Immunisation Program for diphtheria. So there is a strong level of immunity in the population already. However, that immunity does wane over time. Yeah. So you do need a booster.
So through the chair, what was the vaccination rate before the 31st of March, and what's the vaccination rate now for diphtheria?
Thank you for the question. I think we've changed our vaccination schedule during the outbreak response to diphtheria. So there's not an easy comparison to make because we've changed the goalposts, if you like.
Okay. Why is that, through the chair, why has that changed?
We've changed it because vaccination is the most important method for us to boost immunity while there's an active outbreak. We haven't seen an outbreak of diphtheria for many decades in this country, so this is quite unusual, and we don't fully understand the reasons for that yet. That will come in time. However, we do know the most effective public health response, in addition to finding cases and treating them, is to provide a boost to immunity. The vaccine doesn't necessarily 100% prevent transmission, but it prevents the severe illness from diphtheria. So very pleasingly, over the last 6 weeks, I think we're close to 20,000, over 20,000 vaccines have been given across the Northern Territory. It's been a fantastic response from communities. Just under 9,000 of those have been in Aboriginal Territorians. So we've seen a very strong response from a very targeted messaging and media campaign in Aboriginal languages to communities.
Okay, so through the chair, that's a great number, but I just want to understand, Minister, are you able to provide the breakdown of the vaccinations by region? I'm mindful that we've spoken about 9,000 Aboriginal Territorians doing it, but are they from remote communities or are they in our urban and regional centres?
I've been talked to it. Thank you, Member Gorgia, again. The data for vaccinations is fragmented. So some of that data will sit within Aboriginal community-controlled health services, and they exert the rights with data sovereignty to record their own data and share it if they wish to do so. So we respect that. Talking for Northern Territory Health, you've heard our Minister state in his opening statement we have 49 remote primary healthcare sites. We do collect that data about diphtheria coverage against our new recommendation following this outbreak. So we're seeing, again, improvement in terms of vaccine uptake and coverage rates across those communities.
Yeah. So I just want to pick up on a point through the chair that's been made. If I'm in an Aboriginal community-controlled health service, which are absolutely amazing and do a fantastic job, their medical records and the medical records that I have with the Department of Health can be separate records.
Thank you. Getting a little bit more technical here, but I have a long history and understanding of the data infrastructure of the Northern Territory. So,
just to provide some clarification, I'm just wanting to understand from a continuity of care perspective, the Minister's highlighted a number of our clinics are transitioning or already have to AMS. How do we make sure that we know what vaccinations have been done in a... Like, I mean, I put it this way, I got vaccinated for diphtheria at Congress in Mutijulu.
Great.
Is that going to be on my NT health record?
Thank you. I can address your question. Thank you for the question, Member Gorgia. Again, Paul Bootis, Chief Health Officer. So your immunisation details are uploaded to the Australian Immunisation Register, which is a national record that will also flow through your national My Health record. So that data can be accessible and can be no matter where the patient goes. In addition to that, in the Northern Territory, for a long time, we've had a mechanism called the Shared Electronic Health Record, where we do provide continuity of information across community-controlled settings, but also government clinics. So important information doesn't get lost, and so people don't get over-servicing or multiple vaccinations if they've already had one in another setting.
But through the chair, that's the vaccinations, but through a generalised health lens, their systems don't talk.
I'm happy to address that question. Again, Paul Bootis, Northern Territory Chief Officer. Thank you, Member for Gorgia, for your question. They do They do not exchange information in real time, but what we do have is through the Northern Territory Shared Electronic Health Record, a repository where clinicians, no matter where they're working, can look and see where the patient has touched the health system, be that in a community-controlled setting or in a Northern Territory government clinic.
Yeah.
So we do have a line of sight about what care has been initiated, what medications people are on, what allergies they have, and also through the My Health Record, the immunisation data as well. This is a national issue in terms of fragmentation of health data. The Northern Territory, because we have fewer systems, it actually is a better place than most other states or territories.
Yep. Through the chair, statistically speaking, is the Northern Territory the sickest population or jurisdiction?
Happy to address that.
Well, it's a statistical question.
Yeah,
It's not a hypothetical.
I'm just going to
I think
rule
we're getting off
We
track.
are getting off. It's a topic of mind.
I think we,
Yeah, I actually have a follow-up question on the previous line of
on
questioning.
vaccinations.
Well, hang on. I haven't. Is he going to refuse to answer my question?
nobody's refusing, but it wasn't part of the opening statement. We're still on the opening statement. Happy to pick up a lot of these issues when we get to outputs, but we haven't even moved beyond the opening statement at this
Well,
point.
point of order. You've just spoken about health services. Understanding
we're in the
if we're the
opening
sickest
statement.
population or not will help us understand where the investment and where the questions need to be asked.
Minister, just on the question, are we the sickest? I don't have an issue with the question. It is an opinion, but I guess it's seeking a statistical and medical opinion of those statistics. Minister.
Look, I'll ask the Chief Health Officer to provide some more information because there are some critical issues that he can enlarge on around some of those chronic diseases, and it's important to recognise that we put this into context that we're currently $95 million underfunded when it comes to just remote primary health care, and I'm sure the Chief Health Officer will also give some examples of things like rheumatic heart fever where we're again significantly underfunded. So I'll hand over to the Chief Health Officer.
Thank you, Minister. And again, Paul Burtis, Chief Health Officer. Thank you, Member for Gorgia, for your question. I can confirm, yes, the Northern Territory in the national landscape probably has the sickest population. The way we measure that in a technical fashion is called the burden of disease. I'm happy to explain another time the technical nature of that definition, but generally it looks at life expectancy, but also the years lived with ill health during your life. And sadly, for the Northern Territory, our burden of disease globally across the Northern Territory is 1.8 times the national average. If we were to compare our anti-Aboriginal population with the national average, that's 3.96 times the burden of disease. And that's an enormous burden on our health system. And that it certainly does explain our high health service utilisation and also the pressure on our hospitals. Over time, the last few years, we've seen a strong growth in very complex medical conditions, taking up a lot of our beds, and they're sick people. What's driving that are a raft of chronic conditions which are at higher rates in the Northern Territory compared to the nation. So particularly, you've mentioned renal failure, that's underpinned by diabetes, and we also have disease related to overcrowding and poverty. Rheumatic heart disease is clearly one of those, and quite a timely reminder that in the current diphtheria outbreak, that's also accelerated by overcrowded living conditions.
Yeah, thank you. Minister, I'm mindful that we're going to go to a break in a minute, but I'm going to squeeze one question in beforehand. Minister, how many remote community clinics are scheduled to be transferred over to community controlled for this reporting period that we're going into?
Well, there's none scheduled to be handed over at the moment. What I would say is that we've certainly had, I have personally had discussions with AMSANT about the transfer of health clinics to the Aboriginal community controlled sector. There's none scheduled at the moment, but those conversations are certainly happening through Congress and AMSANT at the moment.
And when if they are to be transferred, how does that funding story work? Does the Northern Territory Government come to an agreement where there's X amount transferred for the running of that, or is that direct Commonwealth funded once it's in AMS?
When it comes down to the funding, certainly at the moment, it's probably not an easy answer to talk about what funding transfers, what doesn't. But what I would say is that at the moment there is a difference in the way that the Aboriginal community controlled health services are funded in remote areas compared to the.
That's just relationship driven, isn't it? By the Commonwealth and the Territory.
It is, and that's where, as I've said, we're currently $95 million underfunded by the Commonwealth Government.
Well, you better work to get that money then,
when it comes to remote primary health services, because this is something that the former government had 8 long years to really address, but they failed to do that.
Didn't ask many questions in estimates then, did you?
This is the thing, is that not just 8 years, it was probably 19 out of the last 23.
You were in 4 between those 19 too, weren't you?
Thank you, gentlemen.
Failed to address the long-standing health issues that we see in the Northern Territory. And as the Chief Health Officer said, some of these are driven by overcrowding and conditions in remote areas, and it's just really
a shame housing's been delayed.
It's really a shame that the former Labor government simply didn't turn their mind to
hand over to
the
member for Blaine for a follow-up, and then I know the member for
Go to Ollie first.
Okay, member for Wanguri with a follow-up.
Chair, just to confirm, we're going for lunch at 12, not a toilet break.
Yeah, correct. Thank you, member for Nightcliff. So, correction to what I said earlier, we will break at 12, which was lunch. So, we're just going to push through to 12.
Thank you, Chair. Just to follow up on Member for Gorge's line of questioning with the vaccines, Minister, I'm interested in regards to specifically the meningococcal B vaccination. Can the Minister please tell me how many vaccinations have been done in this reporting period?
Am my mic on? Thank you, member for Wanguri. Meningococcal B vaccines was an election commitment under our government to provide free meningococcal B vaccines and started on the 1st of January 2025. So at the moment, more than 18,000 young people are now protected through the free meningococcal B vaccine. And of course, this came about, it's really the legacy of young Skylar, aged 2, that sadly passed away from meningococcal B in 2017. And the hard work of her parents, Sally and Ash Lawrence. So I am very proud to say that we have now given over 18,000 vaccinations to young people, free vaccines, I should say, in the Northern Territory.
Thank you, Minister. So yes, that's probably answered a couple of my questions there in the total. So that's actually a great number. Are there still any patients presenting with MenB in the Northern Territory? Do we know?
I'll ask the Chief Health Officer to provide an update on that.
Thank you, Minister. Paul Burtis, Chief Health Officer, and thank you, Member for Wanguru, for that question. Sadly, we did have 2 presentations in the reporting period of 2 individuals that did have meningococcal B. There's various strains of meningococcal disease, and clearly B is of great interest to us. No other strains have been notified in the reporting period, but just the 2 for meningococcal, and both of those were B.
Thank you. And probably in regards to the 2 presentations, then how is the MenB vaccination then obviously access to ensure that obviously we don't have any more presentations or going forward?
Thank you, Member Wanguru, for the question. So the meningococcal B program works through two age cohorts. We vaccinate adolescents, and of the 18,386 vaccines given in the reporting period, 8,601 have been given to adolescents, mostly through a school-based program. And then we also provide through the childhood immunisation program, which articulates the national immunisation program, 9,785 doses to non-Aboriginal children under 24 months of age, and an additional 2,791 doses for Aboriginal children under 12 months of age via the National Immunisation Program in the reporting period. So we have the two ways to answer your question are through school-based vaccination, but also through articulation with a childhood immunisation program.
Yep, and probably my last question to the Minister then, is that a cost to the parents, or how is that? Yeah, is it still free? Thank you very much.
Yes, thank you for that question. And what I would say is that, yes, it is free, but it's important to realise that previously families were paying around $130 to $180 per vaccine for infants under 2 that were requiring 3 doses and adolescents needing 2 doses. So the program that we are running has made significant cost savings to those parents that were previously paying $130 to $180 per vaccine. So savings have been well and truly recognised by families across the Northern Territory.
Thank you. Thank you.
Thank you, Member for Wanguru. Minister, I'll now go Member for Blaine with a follow-up as well on vaccines, and then Member for Johnston, then back to the Shadow Minister.
And I only got 2 questions left, so he can wrap them.
I'll try and be quick. So my question will probably go to Dr. Paul Burgess, as it's on the vaccine. I can't remember the word you used, but I've heard it previously referred to as vaccine hesitancy. Do we have... So how long does the diphtheria vaccine last? And that will lead into my next question.
Thank you, Member for Blaine, for that question. Diphtheria vaccine is part of our childhood national immunisation program. So children get between 5 and 6 immunisations during their childhood up to adolescence for diphtheria. And then in the adult program, prior to this outbreak, adults would receive a booster at the age of 55 and 65. So to answer how long does it last? Well, it does last a long time from childhood immunity. However, in the setting of an outbreak, we're boosting people prior to those predetermined vaccine points in the national program. Our current settings are 10 years for adults who are not in settings where there's been active transmission, and for adults who are in an area where there's been active transmission of diphtheria, we're saying in the last 5 years will be adequate in terms of boosting that immunity.
All right. No, so when we did the VAD inquiry last year, we noticed there was a significant amount of public concern about receiving needles. Is there anything that we can do about addressing vaccine hesitancy in these areas?
Thank you, Member for Blaine, for the question. The short answer is yes, there's lots we can do, and a lot of that is myth busting, dispelling myths and misinformation and disinformation. The diphtheria vaccine itself is a very long-serving vaccine, very well trusted. We've been using that since mid-last century, and it's completely safe to give to children, also to pregnant women during pregnancy. So a lot of our approach to hesitancy is to combat misinformation, disinformation with the facts, and also promote the benefits of vaccine. And thankfully, in the current outbreak, we've been seeing a very strong response from Northern Territorians who are coming forward to get vaccinated.
Thank you. Member for Johnston.
Thank you, Chair. Just in relation to from the water questions, really, talking about environmental health through the Minister, what's the cost to the NT Public Hospital system for preventable environmental diseases such as skin and respiratory conditions?
I don't think we have a actual cost on that, Member for Johnston. It would cover quite a number of elements of the health system. Do you want to be more specific, or?
Yeah, sure. Sure. What's the department's annual investment in environmental health programs specifically addressing water quality, sanitation, home conditions, particularly in remote communities, noting that, for example, skin condition is a pathway to rheumatic heart disease. I've seen figures that it costs from an MJA research that it's costing $72 million a year for preventable environmentally caused diseases.
Thank you for the question, Member for Johnson. I'll ask our Chief Health Officer, I should say, to provide some answers to you in that context.
Thank you, Minister, and thank you for the question, Member for Johnston. Paul Burtis, Northern Territory Chief Health Officer. Thank you for citing the Medical Journal of Australia article that we worked very hard to get published. We think this is a really important piece of work to help with advocacy and also to drive programs for better environmental health conditions. The figure, from my recollection, is around 70 million or so, and that's an annual cost to the health system. And I think that provides a really useful benchmark for about our programs for prevention that we're very keen to see expand in coming years.
So is there a budget figure around working on preventative disease?
Yes. Thank you, Member for Johnston, around your question around prevention. I think in the context of an underfunded health system more generally, it's always difficult to argue the case to get prevention funding. We would love to do more with more. Currently, our budget so it's about $28 million, $705,000. But our prevention measures are broad ranging and cover primary prevention, health promotion, secondary prevention for chronic disease in particular, which is an enormous burden that we've talked previously about in this hearing. So that money doesn't go far, and then we need to do more.
I'm going to call lunch there. We'll come back. Member for Johnston, you can finish your questioning, and then it will be the Shadow Minister following that.
After the member for Johnson, we're happy to wrap health.
Yeah. All right. Thank you. We'll now pause for lunch. We'll return at 12:30. Thank you.
Okay, welcome back everybody. Thank you. We've had a bit of a changeover of some positions, so thanks for coming in. I've been advised that there's some responses to some questions taken on notice. Minister, if you'll just repeat the question number and then give the answer, we'll go through that way. Thank you.
Thank you, Chair. I do have responses to questions taken on notice. Question number 5.6. The question was, how many funded nurse positions are vacant across the Department of Health? The answer is, as at the end of March 2026, there were 390.61 FTE nursing vacancies across the Department of Health, and I have a breakdown of each region. The variance in the Barkly region is 33.79. The variance in the Big Rivers region is 22.36. The variance in the Central Australian region is 147.18. The variance in East Arnhem region is 18.94. The top end region, 154.66. The whole of system, 1. Commissioning and system improvement, 2.02. Enabling services, 1. National Critical Care Trauma Response Centre is 1.82. NT-wide services, 2.57. Public Health Division, 5.27. That brings a total of 390.61 vacancies. This vacancy rate does not account for the agency labour hire, which is 278.44 year to date, which equates to a true vacancy rate of 144.58. Question number 5.8. The question was, how many staff work overtime and what was the total overtime bill for NT Health by region? As at the end of March 2026, there were 381 overtime FTEs across the Department of Health, which is $43.8 million. Below is a breakdown by regions and divisions. The year-to-date overtime is NT Regional Health Service, 379.75, and to break that down further, 8.32 in the Barkly region, Big Rivers region 14.29, Central Australia region 99.28, East Arnhem 8.13, NT-wide services 11.99, top end region 237.74, commissioning and system improvement 0.08, enabling services 0.03, National Critical Care and Trauma Response Centre 0.34, Office of the CEO 0, Public Health Division 0.54, whole of agency 0.0 for a grand total of 380.75 overtime per FTE. I think that answers. Oh, sorry, there's more. When it comes to expenditure, as I said, the total expenditure was 43.849. It is so for NT Regional Health Service. The overall total was 43,590. Barkly region 944. Big Rivers region 1,596,000. Central Australian region 11,071,000. East Arnhem 1,217,000. NT-wide services 1,063,000. Top end region 27,698,000. Commissioning and system improvement 28,000. Enabling services 4. National Critical Care Trauma Response Centre 58. Public Health Division 69. Whole of agency 99, and that brings that total to $43,849,000 for overtime for those 381 positions. In regard to question 5.13, the question was in regard to the breakdown of how many remote community clinics can provide an X-ray. 6 NT Health operated community clinics are equipped with X-ray capability and are located in the following communities: Wadeye, Borroloola, Numbulwar, Papunya, Warramayunga and Yuendamu. Thank you.
Thank you, Minister. That's the end of responding to some questions taken on notice. We will now resume. We're still in the opening statement and we're with the member for Johnston.
Thank you, Deputy Chair. Thank you, Minister. Just continuing on from my questions earlier in relation to preventative health, are you able to say what proportion of the health budget is currently spent on prevention and early intervention?
Thank you, Member for Johnson, for that question. Look, when it comes to prevention, obviously there's a whole range of health services that are provided throughout the Northern Territory. Many relate to early intervention prevention. Some, of course, services in response to health problems. Breaking it down into that will be a difficult task, but we could take that on notice if you would like us to, but it will involve quite significant amount of resources to break that down specifically, how that's categorised across the board.
Member for Johnston, is that something that you want them to take on
Yeah,
notice?
thank you.
Okay, Member for Johnston, can you please restate the question for the record?
Minister, what proportion of the health budget is currently spent on prevention and early intervention?
Minister, do you accept the question?
Yes.
Thank you. The question asked by the member for Johnston of the Minister has been allocated the number 5.24. Member for Johnston?
And a follow-up to that, what modelling has the department done on the long-term health and fiscal benefits of increased investment in prevention, particularly in relation to chronic disease, mental health and child wellbeing?
I think we'd have to take that on notice.
Thank you, Minister.
Member for Johnston, could you please restate the question for the record?
What modelling has the department undertaken on the long-term health and fiscal benefits of increased investment in prevention, particularly in relation to chronic disease, mental health and child wellbeing? And just to add, and could you table that modelling?
Minister, do you accept
Sorry,
the
when
question?
you say table that modelling, we can answer the question. So.
So the follow-up of my question was, if that modelling exists, could you share it?
So, Member for Johnston, I think maybe the best thing is to ask the first question and
Sure.
then we can have a secondary question. So the first question will take off the modelling part at the end. Minister, do you accept that question?
We can take that question.
Thank you. The question asked by the member for Johnston of the Minister has been allocated the number 5.25. Member for Johnston?
Thank you. So the follow-up question is, could you please share that modelling?
Yes.
Minister, so that's just tabling. Will you share it through a tabled document or?
Whatever way works. I'm
I
happy.
assume,
talk through?
I can only assume that's in response to the question on notice. As part of that question on notice, we can answer the question and provide any modelling as part of the answer to that question. So I think that's what the member for Johnston's getting at.
Yes, thank you, Minister.
Thank you. Member for Johnston?
Thank you. I have a series of questions for the member for Mulcair. They may not all be against the opening statement, but if you're happy to bear with me when I ask them, Minister. On behalf of the member for Mulcair, in August 24, the coroner provided a report in relation to the death of Mr Marika, who was 38 years old and passed away while family tried to obtain emergency patient retrieval for him in the Lanya area homelands. His death was highly distressing for the family as they drove all the way to the Gove District Hospital, and at some point on the trip he passed away and family felt very let down by the lack of emergency response. The report made several recommendations. Which of these recommendations have been adopted by the department?
We don't have the full details of that coroner's report in front of us, so we would have to take that question on notice.
Thank you. Member for Johnston, could you please restate the question for the record?
Which recommendations from the report, the coroner's report, in relation to Mr Marika have been adopted by the department?
Minister, do you accept the question?
Yes.
Thank you. The question asked by the member for Johnston of the minister has been allocated the number 5.26. Member for Johnston.
Thank you. And just a follow-up to that, which you may also need to take on notice, the final recommendation of the report was for extra resourcing for Nhulunbuy for emergency patient retrieval. Has this happened, and is there an increase in the 26-27 budget?
Thank you for the question, Member for Johnson. I'll just ask Kim Charles, the Deputy Chief Executive, to provide a little bit of detail on retrieval services out of Nhulunbuy.
Thank you. Kim Charles, Deputy CEO, Enabling Services, Member for Johnson. The scope for the new aeromedical tender, which you may have heard is under negotiation at the moment, does include that area and does include different aircraft to get to smaller airstrips. What did happen in the last contract is that area was covered. However, the CASA regulations changed and being able to land aircraft on smaller airstrips became a problem. So that has been considered in the configuration of aircraft for the new contract.
Thank you, which I had a question exactly about that from the member for Mulka. And the second part of that question was, which you may or may not be able to answer, is that under the new contract with RFDS, how many more aircraft will be available for aeromedical retrieval, and how many of these have the capacity to land in homelands with shorter landing strips?
Look, in regard to that question, we are finalising contract negotiations with the preferred proponent. So at this stage, we wouldn't be able to provide the detail of that question.
Thank you. Do you have a time frame, Minister, for when those will be finalised?
End of June.
Thank you. Continuing with the member for Mulka's questions, we haven't even touched on alcohol and other drugs, although you did make reference to it in your opening statement. What AOD residential rehabilitation facilities exist on country for remote community participants? Are these facilities managed by community-controlled organisations, and how many people can they support?
Thank you for the question, Member for Johnson. I'll ask Cecilia Gore, our Deputy Chief Executive from Commissioning and System Improvement, to provide some of those details for you. Thanks.
Thank you, Minister. Thank you, Member for Johnson. Cecilia Gore, Deputy Chief Executive. The only place that we would consider remote or not direct is Tennant Creek. So Tennant Creek has a funded residential rehab called Braddag. In terms of other options for remote, we do fund through the community alcohol plans responses which enable community members and local service providers to take people out on country for respite or healing experiences. So they're not physical buildings that like the rehabs are in that people might otherwise know. That's a very variable figure in terms of how many of those happen in any given period. What we have done in the last 12 months or in the reporting period is uplift the types of supports that are available outside of the urban centres so that people don't have to come to town if they want to have treatment. Treatment can be everything from day program attendance to group programs rather than residential beds per se.
Is there a number of people those programs are able to support?
Thank you for the question. It's more that there's money available for people to be supported rather than a cap on the total number of people. Some of the programs where particularly younger people, have been taken out on country have been done in group settings, so maybe 3 or 4 young people at a time. So we don't have a number which says it would be 100 people in a year, but we certainly could provide info on what has previously occurred. The planning is to and make sure it's available in all of the 5 regions of the Territory for community-led initiatives to strengthen people's wellbeing and get them off the cycle.
I'm sure the member would appreciate that. So do you want that question on notice or?
Member for Johnston, could you please repeat the question for the record?
Sorry, Ms Gore, can you remind me, what did you say you could supply?
We are able to provide information for the reporting period for how many people have accessed the community healing program funding to enable on-country rehabilitation.
That's the question.
We do need you to repeat what you're asking for.
How many people have been able to access
healing programs
on country in the reporting period?
Thank you, Minister. Do you accept the question?
Yes.
The question asked of the member for Johnson on behalf of the member for Mulca. To the Minister has been allocated the number 5.27. Member for Johnston.
And just to follow up to that, through the Minister, you said there's not a number of people, but there's an amount of money. Are you able to say how much that money is for that work?
Thank you, Minister. Yes, so specifically for the East Arnhem region, coming into the new, in this period, the funding that's available for restorative day programs, which is administered through Yalu in Gallowinku, Miwatch in Millingimbi, and the Aboriginal Health Corp on Aliangula. The total is $550,000 for the annual for the period.
Thank you. Is that for the previous period or into the next period?
Into the next period.
Thank you. And one more question for the member for Mulca. Minister, for the community of Nhulunbuy, what GP services will be available when the only GP service closes at the end of this month? What is the government doing to ensure that people have access to continuity of care through a general practice service rather than having to present at the emergency department?
Thank you for the question. I'll ask Fiona Renshaw to provide some detail around that.
Thank you, Member of Johnston. I can provide you with an update in regards to the GP services for Nhulunbuy moving forward. They're currently working through the expression that has gone out for the preferred provider. In the interim, we are working with our emergency department to be able to respond appropriately around coordination of care. We also have our community health services that are also providing an extra level of service to ensure coverage throughout that period. But certainly the access to GP care will still be provided whilst we're going through that process. So the emergency care can certainly provide appropriate responses, and that's predominantly through Category 4s and Category 5 levels of care for our patients.
Thank you. So just to clarify, the access to GP care in the interim will be through the emergency department? Thank you. That's the end of my questions for the member for Mulca. I do have some questions on mental health, but I'm happy if other people have questions first, and I can come back to that.
We're happy for you to skip through those questions because I'm mindful that the Minister still has Aboriginal Affairs, Housing and Local Government.
And we do have output 3.2 is mental health if you want to come through there when we go through the outputs.
I'm happy. Well, it was mentioned in the opening statement, so I'm happy to go through that.
Yep, go for it. Member for Johnston.
And I'm also mindful of time, and Minister, you have a lot of very important portfolios, so I'm interested in moving through these quickly if you're comfortable with that.
Happy to answer any questions.
Thank you, Minister. Minister, the budget shows mental health output's been reduced from 135.049 million to 130.912 million. Can you explain this reduction?
Thank you for the question. There's been certainly no direction from our government to reduce any services across health or mental health. I'm assured there's no reduction in mental health services being delivered. The current bilateral mental health and suicide prevention agreement has been extended for 12 months, while a new agreement is being negotiated with the Commonwealth. I'm advised services provided by contracted non-government organisations will not be impacted, and services will continue to be delivered under the overall envelope of our record $2.56 billion health budget, regardless of minor variations in particular line items. We have the new mental health inpatient unit coming on board at the Royal Darwin Hospital later this year. This work is progressing with the fit-out and the new inpatient unit underway. Certainly, unlike Labor, we make sure there is a budget to operate new wards. The new 24-bed mental health inpatient unit will improve mental health service capacity in the top end for acute patients. We also have the new stabilisation, assessment and referral centre coming online. This new area will provide short-term care for people presenting to the emergency department with mental health concerns. These investments and upgrades will make a real difference to mental health service delivery in the top end. We're also boosting funding for the Northern Territory Suicide Prevention Community Grants Program as part of our commitment to reducing suicide rates. We remain committed to delivering high-quality mental health care for Territorians.
Thank you, Minister, and that's very good to hear. My specific question was, where's that $5 million gone?
So when it comes to the actual variation, I think it's 3.99 million for 26-27. It relates to the implementation of the bilateral agreement NT budget provided in the 25-26 only. So the the bilateral agreement, as I've said many times in Parliament, the bilateral agreement, it's really the timing of the funding. But what I can assure you, Member for Johnson, is that in real terms, NT Health has assured me, and I can assure you that there will be no reduction in services. It's more a timing of when the funding comes on board. But we are using the existing $2.56 billion to ensure that mental health services are delivered consistently with the way that they were previously.
Thank you, Minister. Minister, how many patients spent a day or more as an outlier? Sorry, I just lost my questions. As an outlier awaiting a specialist mental health bed during the reporting period?
Thank you, Member for Johnson. Again, I'll ask Cecilia Gore to provide some information in regard to your question.
Thank you, Minister. Thank you, Minister for... Member for Johnson. Cecilia Gore, Deputy Chief Executive. We don't have in front of us the full count. What we have been doing in looking at the model of care development for Royal Darwin is mapping daily and weekly what the total number of outliers is at any given time. At the moment, we would say that it averages about 4 people a day who are in the tower of Royal Darwin, but it varies depending on pressures and other system issues. So it's not we could not give you the unique number of patients. We could give you the number of beds occupied, but across a period, it's data that's collected to help with service planning into the future.
Thank you. Are you able to give a full count for the reporting period?
We could do bed days rather than patients, if that makes sense.
Yeah, whatever you're able to provide.
Yep.
On notice or?
Yeah.
Yes.
Yep.
Member for Johnston, please restate the question for the record.
In the reporting period, how many patients spent a day or more as an outlier awaiting a specialist mental health bed during the reporting period? I might have said during the reporting period twice.
Yeah.
By bed days.
Yeah.
Yep.
Yeah, by bed days.
Yep.
Yeah.
Minister, do you accept the question?
Yes, we do.
Thank you. The question asked by the member for Johnston of the minister has been allocated the number 5.28. Member for Johnston.
Thank you. How many mental health patients received intramuscular or intravenous sedations during the reporting period?
No, we don't have that on hand.
We haven't got that data in front of us. We could take that question on notice.
Thank you.
Member for Johnston, please restate the question for the record.
How many mental health patients were placed in induced coma? How many mental health patients received IM or IV sedations during the reporting period?
Minister, do you accept the question?
Yes.
The question asked of the member for Johnston of the minister has been allocated the number 5.29. Member for Johnston.
Thank you. Just a few more questions, which you also may need to take on notice. How many mental health patients were placed in induced comas during the reporting period? So,
We'd have to take that question on notice.
Member for Johnston, please restate the question for the record.
how many mental health patients were placed in induced comas during the reporting period?
Minister, do you accept the question?
Yes.
The question asked of the member for Johnston of the minister has been allocated the number 5.30. Member for Johnston.
Thank you. What is the longest period a person experiencing acute mental health illness has spent in an emergency department holding area or other non-specialist setting awaiting admission to a mental health bed in the reporting period?
We would have to take that question on notice.
Member for Johnston, please restate the question for the minister.
What's the longest period a person experiencing acute mental health illness is spent in an emergency department holding area or another non-specialist setting awaiting admission to a mental health bed in the reporting period?
Minister, do you accept the question?
Yes.
The question asked of the member for Johnston of the minister has been allocated number 5.31. 5.31. Member for Johnston.
How many bed days were unavailable to mental health patients due to correctional officers occupying space in the JRU or county wards? Yeah.
Sorry, the presence of correctional officers doesn't take up bed days. Do you want to clarify that a bit?
As a result of accompanying someone, does that have an impact on beds that are available for people? No. Thank you. And corrections have recorded that several people waiting for beds. Corrections has recorded that several people were waiting for beds in the CBU. We also know they had a suicide death in custody this year. Despite the cognitive behavioural unit first being built as a forensic mental health unit, my understanding is that it's still not staffed or funded by health. Is that correct?
Thank you, Member for Johnson. I'll ask our Deputy Chief Executive, Cecilia Gore, just to try to answer that question for you.
Thank you, Minister. Thank you, Member for Johnson. Cecilia Gore, Deputy Chief Executive. The CBU has never operated under health. It was built and then it's always been a correctional facility and continues to be so now.
Given increasing rates of people in the correctional system and the pressures that also places on the health system, I'm trying to think how to phrase this as a non-opinion question. Has there been any analysis of the funding the forensic mental health unit within health?
Sorry, you might need to just clarify that a bit. I think we've made it clear the CBU is part of corrections. Anything around that would need to be referred to the Minister for Corrections. Is there some way of reframing that question that might relate to the Department of Health?
Maybe more explicitly, why has the Minister for Health not funded a forensic mental health unit?
I'll ask the Deputy Chief Executive, Cecilia Gore, to provide you with some information.
Thank you, Minister, and thank you, Member for Johnson. The services provided through the Forensic Mental Health team and the forensic disability team work with people in the system without running the unit inside the wire. One of the things that the CBU currently provides in our system is a space inside the wire run by corrections, which provides the opportunity for therapeutic involvement, respite from the general prison population, and for a place for people at risk. Those people don't necessarily have a chronic mental illness. They may be experiencing situational distress. There may be a range of things. And so at the moment, we don't have sufficient data to suggest that that need should be removed for what is quite a small cohort of people who would meet that other definition of unfit to plead, which is often what forensic mental health means. So the resources are stretched. We work very closely with the corrections teams and their therapeutic teams with our more formal clinical teams to try and support people as best we can and use the resources constrained by the various environments that we're in.
Thank you. Thank you for the answer, Ms. Guyatt, and I know we are under acute strain across all our systems. My understanding is we're the only jurisdiction to not have a forensic mental health unit in health. Is that correct?
We are the only jurisdiction which doesn't have a dedicated forensic mental health separate residential facility.
Thank you. And with expanding prison populations, does that place more pressure on that unit?
Point of order, I think there are.
It's probably more a question for corrections, I think, given the number of people in the prison system. I think this probably lies with the Minister for Corrections.
Okay. Thank you. Although mental health is run by health, not by corrections, is that right? No? No?
I'll ask the Deputy Chief Executive, Cecilia Gore, to just go back to some of these issues once more for you.
Thank you, Minister, and thank you, Member for Johnson. It is a complicated quilt. Within the prison system, corrections does employ psychologists and other therapists to look after the wellbeing of prisoners. They make specific referrals to the more specialist clinical end of the mental health service system, which health holds. And as I said earlier, we do have a forensic mental health team who work in that way. So it's a complementary, joined-up approach. Your question around is the number of prisoners increasing pressure on the CBU, I think, is a matter for corrections. We don't have a say over that.
Understood. I'm happy to move on there if there's any further. Yep.
Are there any more questions on the opening statement? No. No more questions on the opening statement. Okay. So the committee will now consider the estimates of proposed expenditure contained in the Appropriation Bill 2026 to 27 as they relate to the Department of Health. Are there any agency-related whole-of-government questions on budget and fiscal strategies?
No.
No, thank you. Okay, so I've been advised, sorry, that concludes consideration of agency-related whole-of-government questions on budget and fiscal strategies. I've been advised from members that there is one question on output group 3, so if everybody's happy, I'll group up other ones unless there's any other specific output groups that you would like to let me know of right now.
I have a question. I'm not sure which output it goes to, sorry.
What's it on?
It's on the Mental Health Act.
So that would be under output 3? Yep. Okay, so if that's okay, we'll go through. So the committee will proceed and clear output group 1 to output group 2.3. If we're happy, that concludes consideration of output groups 1 to 2.3. And the committee will now move on to output group 3, community treatment and extended care. Output 3.1, alcohol and other drugs. Are there any questions?
Yes.
Member for Blaine?
3.1. Through the chair, Minister, given how alcohol is a contributing factor to a lot of the things that ail our territory, can you tell the committee what the rate of alcohol-related ED presentations is? And Minister, can you explain how your government's alcohol reform is geared to reduce the harm caused by alcohol in our community?
It's your government too, isn't
Thank you for the question. Look, in regard to presentations, alcohol-related presentations, I do have some very interesting statistics, and I think when you look at some of the work that has been done by this government, I just want to talk about ED presentations. I've got some statistics in front of me relating to the period June 24 to May 25 as a comparison to the period June 25 to May 26. What I would say is that what we have seen is a general reduction of emergency-related presentations at the hospitals, and I'll give you some examples. Overall, we're seeing a reduction of about 19.2%, but when we look across the board, the change in Alice Springs has been particularly impressive. The change has been 24.4%. In Gove, it hasn't been as well. It's gone up 4.2%. The numbers are very small. So, for example, in Gove, between June 24 and May 25, there was 287 presentations versus 299 the following year. So the numbers are actually quite small in Gove. Catherine, 21% decline. Palmerston, 6.1%. Royal Darwin Hospital, 16.9%. Tennant Creek Hospital, a reduction in 22%. Look, what I would say is that the numbers vary over quite some time. Whilst we are seeing a reduction, I need to make it clear, whilst we are doing a lot of work when it comes to managing the effects of alcohol, there's still a lot more work that needs to be done. And these statistics, whilst encouraging, we're certainly working on what can be done to make sure that we see a consistent approach across the board. But what we have done is we've introduced changes to the banned drinker register. We've changed the initial 7 days to 28 days, and we've also introduced nuisance public drinking offences as well. So I think overall, when we look at the impact of some of those changes, we have seen some very encouraging statistics, but I would say that there's a lot more work that needs to be done. We have also invested in delivering alcohol and other drug services across the Northern Territory, which includes assessment, residential rehabilitation, sobering up shelters. That includes case management, counselling, support and education services. So we're providing, through this budget, $13.4 million for 159 residential rehabilitation beds. 5.7 million is allocated for 96 sobering up shelter beds. 4.3 million is allocated for tailored support to Aboriginal people from remote communities through support and healing, reach and connect, and continuing care programs. There's also 3.6 million allocated for treatment programs. So, look, overall, the statistics that we are seeing at the emergency department are encouraging, but we've got a lot of work to do. We've been left with some many long-standing, outstanding issues from the previous government, including the effects of the Stronger Futures legislation, which lapsed back in, July 2022, when the Labor government failed to introduce any legislation that would have any impact on the loss of the Stronger Futures legislation. In fact, it wasn't until I think February 2023, the Prime Minister actually had to come to Alice Springs to instruct the Labor government of the day to make changes when it comes to bringing back, what they did do was bring back interim alcohol protected areas. But you know, the damage that was done with the lapse of Stronger Futures, particularly across Alice Springs. We're still trying to work through some of the issues in the town camps because alcohol flowed through those areas for a good 7 months before the Labor government acted and brought in legislation to try and restrict the amount of alcohol going through town camps and going through some of those other areas across the Northern Territory. So, look, the work's happening. There's a lot more to do. The statistics are encouraging, and I really do want to thank our frontline workers that are really making a difference out there at the moment. We've given them the tools to do what needs to be done. We've provided the funding to assist with alcohol treatment and rehabilitation and sobering up beds. We'll continue on that course, and hopefully we'll see some further encouraging statistics as we go.
Thank you, Minister. Are there any other questions on Output Group 3.1, Alcohol and Other Drugs? Member for Johnston.
Thank you, Deputy Chair. The Minister knows I'm very interested in this area. I have many questions, but I will put them in as written questions in the main. I just wanted to seek an update on the alcohol roadmap.
Thank you, Member for Johnson. We're putting together an alcohol plan. So the plan that we're working on, and I do thank you for coming to meet with me. I think it was a couple of months ago now, but the discussion we had about the alcohol plan for the Northern Territory, I must say that there's still work in progress in regard to that, but we are making some headway, and it's certainly getting closer. But we have, as I touched on before, implemented a range of programs to deal with the effects of alcohol across the Northern Territory. What we will be doing is consolidating that into a plan, and we'll hopefully be in a position to release that soon.
Any date, Minister?
I can't put an actual date on it, but if happy to catch up with you again at some point to brief you as we move further with that.
Appreciate it.
Thank you, Member for Johnston. Thank you, Minister. Any other questions on Output Group 3.1?
No.
No.
Madam Chair, I've just got a couple of responses to questions taken on notice, if I could perhaps provide those at the moment.
Point of order. Given the time and the hard-working public servants waiting at the front from housing, perhaps the Minister could just table those.
Minister, I'll give you the option to be able to table those or respond to them publicly now.
I think these are important ones. It's important to get them on the record.
So is housing.
Thank you, Minister. If you could just make sure you repeat the question number that you're responding to.
So question number 5.2, question, how many code yellows were requested but not enacted during the reporting period under the escalation framework, and the average time between recommending and approval enactment, as well as longest time between request and enactment? The answer is that nil code yellows were requested but not enacted during the reporting period under the escalation framework. The average time between recommending and approval, the enactment, is 266.5 minutes, which I'm told is 4 hours 43 minutes. The longest time between a request by the CE and enactment is 926 minutes, which was basically overnight. 5.2.3, I have the answer to that question. The question was, could you provide a list of specialist services available at the Palmerston Regional Hospital? The answer is the Palmerston Regional Hospital delivers the following specialist services: emergency department, overnight inpatient services, which includes geriatric medicine, acute and subacute, rehabilitation subacute, interim care, non-acute patients awaiting nursing home placement, renal dialysis same day, elective surgery same day and up to 23 hours post-operative, which includes plastics, gastroenterology, general surgery, ophthalmology, gynecology, urology, dental, ear, nose and throat, renal vascular access. We also provide outpatient multiple specialties including anaesthetics, endocrinology, gastroenterology, general medicine, general surgery, geriatric medicine, obstetrics and gynecology, hepatology, immunology, infectious diseases, orthopaedic surgery, paediatric medicine, palliative care, rehabilitation specialist medical, rehabilitation allied health, renal nephrology, respiratory, rheumatology, urology. We also have sexual assault referral centre, medical imaging, cognitive and delirium, pharmacy, pathology and Aboriginal liaison. Thank you.
Thank you, Minister. Are there any other questions related? Oh, sorry. No, we're moving on. We've already done that. The committee will now consider output 3.2, mental health. Are there any questions? Member for Johnston.
Chair. Minister, the Mental Health and Related Services Act is the oldest operative mental health legislation in Australia. A revised draft bill was prepared in 24 to modernise the framework and bring it into line with contemporary principles, including rights-based practice and least restrictive care. Minister, can you provide an update on the status of the 24 draft bill?
Thank you, Member for Johnson. What I can say is that on the 16th of June 25, a consultation report highlighted the recommendations for further amendment to the drafting instructions for the bill. Currently, the bill is, we're currently considering the bill in its current format.
So just to clarify, a year ago there was a consultation with amendments?
Yes, there was. That was the consultation report came out in June 2025 and highlighted recommendations for further amendment, and we currently have the bill before us to consider.
Is the government committed to introducing replacement mental health legislation during your term?
We're currently considering what's been put before us so that we can move forward with the legislation.
Thank you, Minister.
Thank you. Are there any other questions relating to output 3.2?
No.
Thank you. So I've been told that there's questions in output group 6, so I'll call for questions on output 3.3, aged care, output 4, disease prevention and health protection, and output group 5, national critical care and trauma response. Are there any questions?
No.
Thank you, Member for Gwadja. So that concludes considerations of output groups 3.3 through to 5. The committee will now proceed to output group 6, corporate and shared services, output 6.1, corporate and governments. Are there any questions?
No.
Okay, thank you. That concludes consideration of output group 6.1. The committee will now consider output group 6.2, shared services received. Are there any questions? Member for Blaine.
Yes, Madam Chair.
Chair,
I hope I have the right output here.
Excuse me, Chair, can I just get a ruling? We did have a number of questions from the government through the health outputs. Are we able to move on to the other topics? The Minister's got a very wide brief.
Member for Nycliffe, there's an opportunity for everybody to ask questions, just not just for opposition. So if you will allow other people to ask questions, that'd be great.
Questions, so hurry
Thank you,
up.
Member for Gwadja. I would love it if everybody just stayed a little bit calm while we finish health.
We're waiting for him to ask his question.
Well, if you guys be quiet, we can do that quickly. Thank you.
Okay, Madam Chair, my understanding is that this is a question for shared services received, as it's probably come from DLI. Given we've been discussing today about the bed pressure that the NT health system is under, and given the increasing demand on territory hospitals, can you comment on what you're doing to deliver more hospital beds and improve capacity? And I believe you and the Assistant Minister opened up the new 32-bed multi-purpose ward recently.
Just say yes.
Sorry, thank you for that question, Member for Blaine. Look, as I've said, we have a record $2.56 billion health budget, which is an increase of $231.8 million in 25-26 budget. The budget includes $18.3 million to open and operate the new 32-bed multi-purpose ward. And I must say that getting out there and having a look, certainly myself, the member for Casuarina, and the Assistant Health Minister, the member for Wanguri, inspected that 32-bed ward. It has been completed, and commissioning is underway for bringing that to an operational stage. So, look, pretty much, unlike Labor, we have a budget to operate these new wards. There's the new 24-bed mental health inpatient unit progressing for delivery later this year. And in regard to that, the total funding, I just want to touch on total funding for the mental health ward 94.3 million for that facility, which includes 30 million from the Commonwealth. Construction is anticipated to be completed in around about August this year.
Thank you, Minister. Are there any other questions on Output Group 6.2?
No.
That concludes consideration of Output Group 6.2 and Output Group 6. So that concludes consideration of all outputs related to the Department of Health. On behalf of the committee, I would like to thank officers who provided advice to the Minister today. The committee will move on to consider outputs relating to the Department of Housing, Local Government and Community Development. Minister, would you like to quickly thank your department?
Yes, thank you, Madam Chair. I'd like to thank our Chief Executive, Susan Bound, but special thanks to all of the executives here today, but a special thanks to all of those staff that have been in the background spending lots and lots of time preparing for estimates. The work that you've done, whilst some questions weren't asked today, the work that you've done has been absolutely impressive and informs us in many, many ways about the health system. So thank you very much.
Thank you, Minister. We will have a really quick break while we do a transfer over to the new department, and we'll come back at 1:26. 5 minutes. There we go. Okay. Minister, I welcome you as the Minister for Housing, Local Government and Community Development and the Minister for Essential Services, and invite you to introduce the officials accompanying you and to make an open statement of no more than 20 minutes regarding the Department of Housing, Local Government and Community Development. I'll give you a 5-minute warning at the 15-minute mark. Minister, you have the floor.
Thank you, Chair, and I'd like to introduce the members of the Department of Housing, Local Government and Community Development who appear with me today and will also assist me to respond to any questions. I have on my left Mr Tom Leeming, the Chief Executive, Ms Josie Kerr, the Deputy Chief Executive for Practice System Improvement and Reform. Down the end I have Ms Ruth Lansky, Acting Deputy Chief Regional Delivery Officer. On my right I've got Ms Margaret Close, who's the Deputy Chief Executive of Corporate Strategic and Enabling Services. And we also have Ms Tamara Biro, who's the Acting Chief Financial Officer. It gives me great pleasure to speak of my portfolio responsibilities as the Minister for Housing, Local Government and Community Development. Chair, the department has an operating budget of almost $1 billion and an FTE of almost 600. The department has a broad footprint across each region in the region of the territory, delivering services directly to Territorians through housing, community development, interpreter and translator services and local government. It is also the custodian of some of this government's significant reforms. Across this portfolio, the government's priorities of reducing crime, rebuilding the economy and restoring the territory lifestyle are being turned into practical action. We are making public housing neighbourhoods safer and more accountable. We are driving housing, local government and community reforms that support jobs, investment and stronger regional economies. And we are working to restore livability, amenity and confidence in the communities across the territory. The department is taking on issues that were allowed to drift for too long and making decisions that support Territorians now and over the longer term. There are 3 major reform priorities I want to highlight at the outset because they go directly to what Territorians rightly expect from this portfolio. Safer neighbourhoods, stronger communities, better services and housing system that works. The first major reform priority is a public housing reform and tenant accountability. Public housing should provide safety, stability and opportunity. It is not a licence for repeated antisocial behaviour, property damage or rent avoidance that undermines neighbours and communities. We inherited a legacy of watered-down accountability, leaving public housing tenants who caused repeated disturbances, threatened their neighbours, threatened each other and blatantly disregarded community standards to remain in public housing with little to no repercussions. And too often it was other tenants and nearby residents who were ones paying the price. This government has changed that. We have made it clear that public housing comes with responsibilities. Pay the rent, look after the property and be a good neighbour. And where those obligations are ignored, there will be consequences. Our government is here to continue cracking down on crime and focus on the root causes of antisocial behaviour to restore our beautiful territory lifestyle. In February of this year, we released the Tenant Accountability Policy Statement, reaffirming our commitment to growth, certainty and security. This will help to reduce homelessness, supports economic participation and ensures access to essential services. It sets out a clearer, firmer and more honest approach to tenant accountability and antisocial behaviour. It is why the department has increased compliance and enforcement activity, backed stronger frontline action and used tenancy tools more decisively where necessary. This is a deliberate shift towards a system that better protects tenants who do the right thing, and it is already producing results. Between 1 July 25 and 31 March 26, there were 40 terminations and voluntary relinquishments as a result of the department taking strong compliance action. This is from the efforts of the frontline staff with a government that backs them to do their jobs, streamlining processes to take effective and sustainable action. We have also amended key operational settings and are exploring legislative amendments. Those outcomes show when government sets clear expectations and backs them up operationally, behaviour changes. They show that reform is not just being announced, it is being implemented, and they show what delivery against the government's crime reduction pillar looks like in this portfolio. The second major priority is the empowering the bush agenda. At its core, this is about shifting from top-down decision-making to stronger local voice, stronger local governance, and more place-based development in regional and remote communities. It is about ensuring communities are heard, local aspirations are respected, and reforms are shaped in a way that is practical, locally appropriate, and sustainable. This work goes directly to rebuilding the economy. In the Barclay, that work is already well underway. As at the 24th of April 2026, the Department is engaged with 210 traditional owners, residents and community members, along with the Barclay Aboriginal Alliance, Aboriginal corporations and all three levels of government to understand reform priorities and community aspirations. This is serious groundwork for serious reform. We are working with communities as they consider pathways to stronger representation, better service delivery, and where they are seeking it, de-amalgamation options. This government is committed to strengthening local government through targeted practical reforms that improve governance, transparency, capability and community confidence. Communities rightly expect councils to be well governed, responsive and able to deliver. That is particularly important in regional and remote areas where local government is central to everyday livability and local service delivery. Stronger local government supports safer communities, more resilient regional economies and the quality of life Territorians expect in the places that they call home. That reform is now being backed by legislative change. Parliament passed the Local Government Legislation Amendment, Code of Conduct and Other Measures Act 2026 in March, with the first parts commencing in April and the remaining parts will commence from 1st of July 2026. These reforms strengthen election processes, delegations, training requirements, conflict of interest provisions, the Code of Conduct framework and governance support arrangements. They reflect a practical and staged reform agenda designed to strengthen confidence in the sector and lift standards across local government. The third major reform project is the development of the Northern Territory housing strategy. The Northern Territory government is focused on building a safer, stronger and more prosperous territory. One where more people choose to live, work, visit and invest. Housing is central to that ambition. It underpins workforce growth, supports safer and more stable communities and helps make the Territory a more affordable, livable and attractive place to call home. The Territory's housing system is shaped by unique geographic, climatic and market conditions. Across the Territory, work is already underway to increase supply, improve affordability and strengthen housing responses in urban, regional and remote communities. The housing strategy will bring all of that work together because housing challenges in the Territory are system-wide and they require a coordinated response across government, industry, communities and the non-government sector. Government undertook extensive consultations on the strategy across the Territory between March and May this year through industry briefings, peak body workshops, regional and remote workshops, one-on-one meetings and a public Have Your Say survey. Stakeholder consultations highlighted several consistent messages for the housing strategy. And these include housing is essential economic infrastructure. The NT needs place-based solutions. Regional planning is critical. Investment needs certainty. Better information will drive innovation. Government investment is lifting supply and stronger coordination will unlock delivery. The government has listened to that feedback and these will be addressed in the housing strategy. In relation to public housing, we are looking at things like how we can reduce the density of public housing in key areas and recycle and renew assets and look at mixed tenure redevelopments. The objective is straightforward, to replace ageing public housing with modern mixed tenure communities that reduce concentrations of disadvantage, improve neighbourhood amenity and support better outcomes for tenants and surrounding communities. We are also taking significant action to bring viable public housing stock back online, a legacy left behind by the former government, and taking a more strategic approach towards asset management. Many long-term vacant properties are ageing or uninhabitable, require major repairs or upgrades or are affected by workforce, logistics and procurement constraints. In Alice Springs, this includes targeted work to return around 70 vacant houses to service. More broadly, it means reducing backlog, improving turnaround performance, focusing on electrical safety and making clearer decisions about what properties should be repaired, upgraded, redeveloped or disposed. When it comes to community housing, the community housing sector has been heavily involved in discussions around the housing strategy. community housing is an important part of the housing ecosystem, and I want to be clear that the government has not walked away from working with community housing providers. The sector manages a substantial number of homes. Our position is that any further transfer of assets must be based on the right policy settings, the right delivery model, and confidence that it will improve outcomes for tenants and for the housing system. We are considering this properly in the context of the broader housing strategy and the wider reform agenda. I look forward to releasing a strategy early in the coming financial year which addresses that and provides a roadmap for reform over the next 3 years. When it comes to remote housing, we are making significant progress in remote housing. The NT Government remains committed to the $4 billion remote housing agreement and to working constructively with the Commonwealth, the Joint Steering Committee for Remote Housing, land councils and Aboriginal housing partners. Early delivery has been positive, with over 300 homes delivered and a strong pipeline supporting local jobs and reform. But we will also continue to advocate strongly for the Territory's interests. As you would expect in an agreement of this scale, there are ongoing discussions about scope, and we are currently working through points around land servicing and program management costs. We are awaiting confirmation that the NT Government can spend its own investment on land servicing and program management. Homes cannot be built without service land and program management, which includes design, consultation, procurement, contract management and tenancy support. I've had positive discussions with my Commonwealth counterpart about this, and I hope that it will be resolved soon. It is important that we do get this resolved as soon as possible. Madam Chair, recent flood and fuel crises are diverting contractor capacity and increasing prices, and these flood crises have hit many of our remote housing tenants hard and impacting our housing assets across a number of communities. We acted quickly by confirming that we would provide rent relief for affected tenants through an emergency rent rebate that would reduce rent payable by eligible tenants to zero. That approach was designed to get support to tenants as quickly as possible rather than waiting for a perfect administrative solution. And this was within difficult operational circumstances, including limitations on the tenancy management system. The department has since reviewed the process, listened to feedback, and will make sure that rent received during the pause can be returned to tenants. That is the responsible thing to do, and it sits alongside the much broader practical assistance provided to displaced communities during and after those events. When it comes to remote rental framework, we have also written to tenants recently about the High Court's decision in December 2025 around the remote rent framework. Essentially, the High Court found the remote rental framework introduced by the former Labor government as invalid. We respect the High Court's decision. We acted immediately to ensure rent could continue to be set lawfully and that there would be no immediate change to the amount remote rent public housing tenants currently pay, which has provided continuity and certainty while dealing with the consequences of the decision. At the same time, we have engaged financial specialists to assist us to review rent payments made between February 23 and February 26 and advise us on options for repayment where required. Once we have worked through this process, we'll be in contact with tenants to discuss the way forward with their accounts. In parallel, we will soon be engaging widely on a new remote rent framework with a view to having a new framework confirmed by the end of 2026. The timing of this will be in part guided by our key stakeholders and how they want to be involved in the process. When it comes to homelands, we're also working with land councils, Aboriginal Housing NT and the Commonwealth to develop a new homelands policy and strengthen longer-term arrangements in relation to homelands. The NT is home to around 600 homelands. Most of these are located on Aboriginal land under the Commonwealth's Aboriginal Land Rights Act 1976, and the dwellings are privately owned. Each year, the NT Government invests approximately $40 million to ensure homeland residents have access to essential services such as power, water, sewerage and municipal operations, including waste management and road maintenance. I understand how important homelands are to residents and the need to get clarity around their future. But I want to make sure people understand that the tenure arrangements for homelands are very different to communities and involve a different set of considerations. When it comes to town camps, the government is also working to address concerns about town camps and the department's role in providing housing-related services. It is important not to reduce a complex set of issues to the simplistic claim that delays occur because the department is not signing off work quickly enough. Town camps involve complex land tenure, service delivery and governance arrangements, and those complexities can affect how quickly issues are resolved. That is exactly why the department has been undertaking consultations with key stakeholders and is working with contracted partners to improve and better integrate tenancy services, repairs and maintenance, and municipal services. The department will also work through the Joint Steering Committee for the Remote Housing to redesign contracts so that service delivery is clearer, stronger and more responsive, while also supporting local workforce engagement and a staged transition to greater community control. Better service delivery in town camps is essential to safer communities, improved amenity and stronger community confidence. Chair, we are addressing complex issues in this portfolio. Many reflect long-standing structural challenges across housing, local government and community development in the Territory. But this government is not pretending they don't exist. We are addressing them through practical reform, stronger accountability, careful policy development and sustained engagement with communities, councils, the Commonwealth and the sector. Madam Chair, I should say, the budget before the committee today supports that work. I look forward to answering the committee's questions. Thank you.
Thank you, Minister. I will open up the floor for questions and I'll start with the Shadow Minister. But I just wanted to remind everybody in the room to be respectful, not jump in, not talk over the top of each other and go through the chair for your questions. I will give warnings if I need to. Thank you. Shadow Minister, Member for Nightcliff.
Thank you, Chair. Indeed, lots to get through today. Minister, in a press release in July 2025, you claimed you were building 102 new social and affordable homes across the Territory. Can you please update us on what progress has been made across those 102 houses and where they're located?
Thank you for the question, Member for Nightcliff. I'll ask our Chief Executive to give you an update on the progress of that announcement.
Thank you for the question, Member for Nightcliff. Tom Leeming, CEO. I believe that the 102 homes you're referring to were the ones that were successful bids by NT-based community housing providers for funding under the second round of the Housing Australia Futures Fund. So there were 102 successful social housing projects bids put up by social housing providers, community housing providers supported by the NT government and our department through that process. And that's 14 by Community Housing Central Australia, 6 by Venture Housing and 82 by Community Housing Limited. Those are, as is the case for almost the entirety of Housing Australia Future Fund, the way that the Housing Australia Future Fund has been delivered and the investment mandate that Housing Australia have under the legislation, the investment happens and the delivery of those projects happen through community housing providers. So it is Community Housing Central Australia, Venture Housing and Community Housing Limited who are responsible for the delivery of those projects. We work with them to check in on how they're going. I don't have detail on exactly where those projects are up to, but we do work actively with those community housing providers to understand and work with them on those projects.
So, Minister, we don't have any progress data, completions, locations for those 102 houses?
Locations.
We do have the location data, if that's what you're after.
Yes, please.
We can also get the progress to you on notice if you require, but we'll have to talk to the people that are delivering the projects.
Sure. Should we take it all all on notice, Chair.
Take it all on notice.
We can take it all on notice and we can get an update from the community housing providers exactly where the program is up to at the moment.
Okay.
Member for Nightcliff, please restate the question for the record.
Minister, can you give us an update on the progress in terms of status, under construction, completed, not yet started for the 102 new social and affordable homes across the territory and where they're located?
Minister, do you accept the question?
Yes.
The question asked by the member for Nightcliff of the Minister has been allocated the number 5.32. Member for Nightcliff?
Minister, in terms of the total urban social housing stock, according to the budget papers, there was a target of 5,280 for 25-26, and the current estimate is 5,260. Has the total housing stock of social housing dropped by 20 houses?
Thank you, Member for Nightcliff. I'll ask the Chief Executive to give you an update on that.
Thank you, Member for Nightcliff. Indeed, the point of time comparison that we're estimating by the end of this financial year is 20 homes less than the target and 5 homes less than was the actual at the 30th of June 2025. That is mostly because of the cessation of social head leases. So there have been, the government entered into around 10 years ago a number of head leases with private developers and private owners of properties around the territory, particularly in urban areas, for us to have long-term head leases over those houses so that we could use them as social housing. As those leases are now expiring, because they were 10-year leases, some, but not all, of those private landlords are choosing not to roll over and continue to offer them to us as social housing dwellings. And there's been a fall of 43 of those over the period as a result of those private landlords not choosing to renew leases. And so that fall of 5 is 43 of those offset by other new stock coming on.
Thank you for that response. Can you just, so this is a total drop of 43 from the reporting period. Was there any new long-term contracts entered into for social housing through private providers in that same type of procurement?
I don't believe so, no.
Okay. Minister, does the department have any plans to enter in new long-term agreements, or are these going to slowly drop away, reducing our overall social housing stock?
The latest investment will be through HAF and the SHAP program. Head leases, as the Chief Executive said, were entered into quite some time ago. At the moment, some of those are expiring, but the current investment, we're looking at the HAF and the SHAP program.
Okay, so no new engagements with those head leasing. Minister, are you selling off social housing?
The houses that we have sold, we've sold one to a person occupying the house. So there is options for those tenants that can meet the criteria to buy that. We've also had 2 other applications in regard to that. But when it comes to selling off in general, we haven't been selling off in general social housing. It's really what we have done is continue to open that up to tenants that are occupying social housing. We're certainly giving tenants the best opportunity as a start in life to purchase the existing homes that they're living in.
So it's only one sale during the reporting period. Is there any plans for public housing sales in 26-27?
Look, not in regard to selling, but in my opening statement we spoke about renewal and those type of programs. But we are getting to the latter stages of putting the housing strategy together, and that will include looking at all different housing mixes across the board. So when it comes to selling, as you've put it, in regard to social housing, what we are looking at is the best way to redevelop some of that existing stock into mixed use. We are looking at all of those options across the board.
Thank you, Minister. Is there any funding in the 26-27 budget for those type of renewal projects that you've just mentioned?
I'll ask the Chief Executive to give you an overview of that. Thanks.
Thank you, Minister, and thank you, Member for Nightcliff. The funding in some of the funding in the budget for proposed projects under the third round of the Housing Australia Future Fund will be renewal of land we already own through community housing providers. And as was discussed during the Department of Chief Minister and Cabinet's estimates hearing, they have an allocation to progress some elements of the housing strategy and the work that we're doing jointly with the Department of Chief Minister and Cabinet on de-densification, which will include and have a strong focus on mixed-use redevelopment and renewal of old public housing complexes that are nearing the end of their economically useful life.
So there's no standalone funding outside of the HAF program, Minister?
No. There's, as we said, we're focused on reviewing densities, providing alternative housing models. All of that will be considered, particularly through our new housing strategy. But when it comes to HAF, and we're certainly looking at how to maximise the funding in those areas. When it comes to urban public housing, we have $5 million in the budget to focus on a rolling program to refresh public housing stock. So there's currently $5 million in the budget for that.
So, Minister, will there be any new urban social houses constructed in the period? Sorry, I'll go again, Mr. Sorry, will there be any new urban houses constructed next financial year? And can you give us a breakdown by region?
I'll ask the Chief Executive to provide that for you.
Thank you.
So there's a combination of different programs that will fund new public housing stock in urban areas across the territory, and each have their own approaches and timeframes and so on, but I can run through some of that. There's the Social Housing Accelerator payment, which is constructing 79 new dwellings, of which 36 have been completed, and most of the balance of that will be completed in the financial year coming. They're all contracted. So that's what's coming on SHAP. I should say 77 new, 2 upgraded. There's the various HAF rounds. So HAF 2, that's the 102 we spoke of before. And depending on the outcomes of Housing Australia's consideration of the various bids being put in by some combination of our department and community housing providers who are the proponents for those proposals, we will be getting a significant number, I hope at least 200 of additional houses, although noting that they, given the timeframes involved in HAF funding, they are unlikely to be completed by the end of the coming financial year. And then in addition to that, you've got the $5 million rolling program the Minister referred to, which is a long-standing rolling program of $5 million that Department of Logistics and Infrastructure manage on our behalf, because they do all the, either Department of Logistics and Infrastructure or community housing providers do all the actual construction and contract management of builds for us. We don't, as a department, build our own houses. We get either the community housing sector or Department of Logistics and Infrastructure to build our houses for us, or build houses for us. And on top of that, but not yet known because we're still doing the work on the strategy and the de-densification analysis, there may be some additional work on to implement de-densification, including mixed-use redevelopment of existing assets that are nearing the end of their economically useful life.
Member for Nightcliff, we've just got a follow-up question by the member for Johnston.
Thank you, Deputy Chair. Thank you, Minister. Thank you for those numbers. How many people are currently on the urban social housing wait list?
Thank you, Member for Johnson, for your question. At the moment, when it comes to numbers on the wait list, we have applications for urban public housing as at the 31st of March 2026. That varies across 1 bedroom, 2 bedroom and three greater than 3 bedroom or greater. At the moment, the general wait in regard to general wait times, we have a total of 3,225 applications for urban public housing. That includes Darwin 1,194, Palmerston 512, 375 in Katherine, 147 in Nhulunbuy, 125 in Tennant Creek, and 872 in Alice Springs. So all up, we also have a priority wait list as well, which has 2,262 people applying for priority housing at the moment.
Thank you. And in relation to new housing, through the Minister, I just got that there's 179 new houses projected over the next year, with 2 being refurbished. Is that correct?
I'll just get that data for you.
and apologies, Member for Johnston, it can be, because there are so many programmes involved, each with different rules and different delivery people, it can get a bit complicated. But in the coming financial year, there will be the 43 remaining social housing accelerator payment houses come online. There will be a significant proportion, but I don't have the details on exactly whether they'll all be delivered this financial year, but I suspect most will be, of the 102 Housing Australia Future Fund Round 2. And there will be some from our $5 million rolling programme, but I don't have the number on that, but given it's 5 million, it will be less than 10.
So around 150.
That kind of magnitude, yeah.
Thank you. And there's just over 4,500 people on the waiting list.
There are,
there's a number.
Sorry, 5,000.
5,487 is the sum of the two numbers the Minister mentioned, yeah.
Thank you. And I just wanted to follow up on one other area that the member for Nightcliff was asking about. You talked about the NT housing strategy, and the previous one expired in 25 and included a commitment to evaluation at the end of that period. Has that evaluation happened?
No, as I said, we're in the progress of developing the new strategy that will be, obviously we pick up learnings from previous strategy, but the development of the new strategy has been underway from, I think I said from March till May, I think I said. So all of those consultations and obviously learnings from previous housing strategy, but learnings from the sector themselves, from the interested stakeholders that have contributed, have given us lots and lots of information to work with.
Thank you. So we've just got another follow-up question here from the member for Cromer.
Thank you, Chair. Minister, I'm just following up on the density issue raised by the member for Johnson. As you know, I've mentioned many times in Parliament that we have a major issue in Karama and Malacca regarding an overdensity of public housing. For example, Mistletoe Circuit in Karama and the large housing complexes in Malacca around Fawcett Court, Magdalene Court, Tabletop Place, complexes that unfortunately really are feeling like ghettos. So what I want to know is, what is the approach that you and your agency are taking to address this density issue?
Thank you, Member for Karama. As I touched on in the opening statement, we're working on a review of all social housing densities in key suburbs, which includes your suburbs, I should say, Member for Karama, and options to address the areas and suburbs of high density. We'll be doing that in consultation with the Department of the Chief Minister and Cabinet. NT Government is investing $1.5 million to explore options, the economic feasibility and marketplace testing, including conceptual designs resulting in redevelopment of current social housing sites. The social housing redevelopment, which I did touch on before, to deal with ageing public housing. The intention is to look at de-densification, provide alternative housing models, increase private investment, address mixed housing needs and provide positive social and improved community outcomes. We are in the early stages. The housing strategy clearly picks up on those very issues that you raised, because you're right, these have been long-standing issues that haven't been addressed by previous governments. We're looking at these very closely because at the end of the day, as I touched on, we want to see good neighbours. We want people to pay the rent and look after their house. And so we're looking at trying to get the best outcomes for not only the tenants living in social housing, but outcomes for people, the neighbours living in those areas as well. So yes, it's early, but what I can assure you, Member for Cromer, is that work is underway and will be dealt with through the housing strategy.
Thank you. Member for Nightcliff.
Thank you, Chair. Minister, can you update us on how many houses underwent repairs and maintenance in the reporting period?
Is that urban or remote?
If we get a breakdown of each, please, Minister.
I'll just touch on urban first.
Sure.
What I can say is we obviously do deliver repairs, maintenance and minor new works programs right across the territory. So when it comes to the urban housing portfolio, our focus is on maintaining safe, functional and appropriate housing. In 25-26, sorry, where was I? Sorry, in regard to orders, I was going to say, in regard to urban orders raised, and this doesn't give a breakdown of each number of houses, but overall, for the period up until the 31st of March, the number of orders that were raised by, I have that by region if you want me to give that breakdown, but in total there was 17,806 orders raised in regard to repairs and maintenance across urban housing.
That's the number of individual houses that have had.
Right, and sorry, I'll just expand on that further. When it comes to urban public housing, minor new works, there was 217. When it comes to general repairs and maintenance, 3,881. And due to disaster repairs and maintenance, there was 388. In regard to overall cost, when it comes to minor new works, 8.638 million. When it comes to repairs and maintenance, 19.395 million, and that brings to a total of $28,033,000.
Thank you, Minister. Can you quantify how many outstanding requests or outstanding orders for R&M you currently have for urban housing?
Obviously, given the number of houses, there would be perhaps a number of open work orders on any given day, so it'd be a difficult one to quantify. We don't have the statistics in front of us, if that's what you're after, but oh, we do. Sorry. Well, there we go. We do have some open orders. When it comes to minor new works, the information that I have, this is at 31 March. Total less than 30 days, 150. Greater than 30 days, we have 5. When it comes to repairs and maintenance, numbers of orders open by region, greater than 30 days is 235. In total, we have a total of 2,923 orders open as of the 31st of March 2026.
Thank you, Minister. And can you advise what the average wait time is for one of those R&M requests to be actioned?
Just bear with us while we find that. Thank you, Member for Nightcliff. I have information, average business days to complete repairs and maintenance work orders by region for the, at the moment for average days when it comes to, and I've got some statistics here, when it comes to Casuarina for up until the 31st of March, work orders, business day, average business days, Casuarina 4, Darwin 5, Palmerston 4, East Arnhem 7, Catherine 51, Tennant Creek 16, Alice Springs 23 days. On average, the total days to complete repairs and maintenance on average is 14 days.
Thank you, Minister. In terms of vacancies, we've obviously got this massive waiting list, as was identified through those previous questions. Can you please explain why only 1 in 4 houses are being turned around, either social housing is being turned around within that 70-day time frame? That's the goal in the budget papers.
Madam Chair, just after that question's been asked, I've got a follow-on about vacancy.
Thank you, Member for Nightcliff. Look, when it comes to urban public housing dwellings occupied within 70 days of vacancy, in 25-26, the Northern Territory Government allocated an additional $17 million to address deferred maintenance, asset deterioration, the backlog of long-term vacant dwellings across the urban housing portfolio. This funding included $7 million specifically targeted at refurbishing long-term vacant properties to support the return to service. As at the 31st of March, a total of 228 dwellings had been scoped for repairs, with 120 works completed and a further 104 properties undergoing maintenance. The allocation of these refurbished dwellings is expected to impact the proportion of homes occupied within 70 days, reflecting the extended periods many have remained vacant while awaiting necessary repairs. I'll see if the CEO's got anything further to add on that.
Partly it's a statistical thing. So we realised last year that this number had been creeping up over many years, and we, thanks to getting some additional funding, have made and pretty much finished implementing a plan to clear some of that backlog of those houses, which is the 228 urban public houses that the Minister refers to that had formed a backlog of incomplete maintenance for vacant houses. What we've done, invest $17 million in getting those houses back on stream. As of the 31st of March, 104 were back in service with tenants off the wait list in them. The remaining 120 are well underway to be completed by the end of the financial year. But what that does is, temporarily to the statistics, because we're bringing long vacant houses which hadn't been recorded because they hadn't gone back into service, because we're bringing them back into service, that then drives the apparent performance down because we're realising the long backlog. But so in future years, you'll see that number look much better because we've cleared that backlog.
Thank you. Member for Gwadja.
Thank you. Minister, can you provide the details of the property that was vacant for the longest period during that reporting period?
In Catherine, looking at the longest vacancy turnaround time, the longest vacancy we have on record was a property. Now I don't have the dates for this, but the longest was 2 years and 10 months.
And that's, just to be clear, that what I'm asking about in the reporting period.
So that's the latest data we have.
Okay. So that's as of now?
Yeah.
Okay, that's fine. Thank you. And if I may, Madam Chair, Minister, I've had a look on your website and it hasn't been updated since August of 2025, Our Homes, Our Futures, Our Communities. What is the government's commitment to building, or will you build new homes on town camps within this financial year? Or for the purposes of you, Member for Barkly, Aboriginal living areas?
Well, thank you for the question, Member for Guaja. And when it comes to town camps, also known as community living areas, there are local people use different names for those living areas. Essentially, most of those town camps have mixed tenure, I'd say, and some of those town camps come under the remote leasing program. So when it comes to building new homes in town camps across the board, decisions around programming, for example, are made through the Joint Steering Committee. But I'll check on what program we have in place at the moment. But my recollection was that.
Sorry, are you referring to this financial year or next financial year?
I'm asking for next financial year. I'm trying to understand. I think the last person who built a house on a town camp was me. So I'm just trying to understand, what are you going to do, Minister, this financial year we're about to walk in?
What's your trade qualifications?
Will you build a house on those town camps?
What's your trade qualifications?
Well, I'll give you my resume if you want to have a look.
Can we direct a question?
Yeah, I want to know how many houses you're going to build from the department on town camps
let me make this
financial year that we're going into.
Let me make this very clear that decisions around program are made by the Joint Steering Committee.
So you're blaming the Joint Steering Committee?
Member for Guaja, can we please direct the questions through the chair?
Let me make this very clear.
Through the chair, can you please...
Let me answer
Let the Minister
the
answer the question.
Let me make this very clear. Decisions around program under the $4 billion remote housing agreement are made through the Joint Steering Committee. Now, I'll see if we've got the information on hand here, but I'm not sure why you would point the finger at the government, because, as you know, the Joint Steering Committee is made up of the Northern Territory Government, the Commonwealth Government, the 4 land councils and Aboriginal Housing NT. So there is what we call joint decision making through the Joint Steering Committee. So let me see if we've got that data. If we haven't got the data, I'm happy to take that on notice for you.
Through the chair, Minister, if I may, what I'm trying to understand is your website hasn't been updated since August. People in remote locations and town camps are asking, what are we receiving from this package? Can you give us those numbers of town camps and remote communities? Because people want to know what's being built, when it's being built.
Look, we do have the list, so I'll ask the Chief Executive to outline precisely what the program is for remote housing, which includes those leased town camps.
Thank you, Member for Guaja. It is, as you will appreciate, with the 73 remote communities and the 14 town camps in scope of the remote housing agreement, it's a long list. I wonder if that might best be one that we take on notice.
Yep, sure. Happy to.
I think we can.
We can table the report if that's the list, if that's what helps.
Just happy to take it on notice. That's fine.
We'll take the question on notice. That is a long program, so just to save a bit of time, I know the opposition has a few more questions. I'm not sure how many, but we'll take it on notice.
Member for Guaja, can you please restate the question for the record?
Yes, I can. Thank you, Madam Chair. Minister, could you please provide a breakdown of the number of homes scheduled for construction in the bush and in the town camps and community living areas?
Minister, do you accept the question?
Yes.
The question asked of the member for Guaja to the Minister has been allocated the number 5.33. Member for Nycliffe.
Thank you, Chair. Minister, do you have any plans to redevelop the Litchfield Court complex in Coconut Grove, given its ageing infrastructure and lack of fit-for-purpose housing?
No, we don't have any plans to do anything there. Obviously, we'll look at all housing across the territory when it comes to de-densification all of those options are on the table, but we don't have any immediate plans.
So it will be considered as part of that project with
All
CM&C?
all housing across the board will be considered across that de-densification project. So, but there's no immediate plans in place to change Litchfield Court.
And so also in terms of the operation of the Litchfield complex at the moment, previously I believe there was some private security service provided on that particular complex. Can you please advise if that is still in operation?
Whilst we provide tenancy and property management services, I believe security arrangements are through Department of Children and Families.
Children and Families. So housing's not aware of those arrangements, Minister?
That's a question for the Minister for Children and Families.
Okay. Minister, there's a $1 million grant listed in the budget in terms of relocating Osnum House. Can you explain what the funding's for and the timing around that?
I'm just going to step in a minute. I don't believe that sits with the Minister for Housing. I believe that sits with the Minister for Lands Planning and Environment. Might be a question for this afternoon.
Yeah, sure. I thought it was under Housing and Community Development, but...
BP 4, page 13.
It's currently being considered as the broader strategy around HAF funding at the moment.
So it does sit with the department?
That funding allocation, yes.
So the Osnum House relocation is part of the broader HAF, so we have to wait for the outcome of the HAF decision.
I'll ask the Chief Executive to give a bit more detail around that for you.
So the money that we have in our budget concerning Osnum House was part of the broader original budget allocation for the relocation of Osnum House. The re-establishment of those facilities, short, medium, long term, is a Department of Children and Families and Department of Lands Planning and Environment question. The bit of it that we've got was originally envisaged to be about redevelopment of the Westralia Street site, but is currently being considered within the broader question of the questions you were asking earlier about what funding do we have and what strategy do we have around Housing Australia Future Fund Round 3.
Okay, so that's for the Westralia site, not for the current Coconut Grove and future site.
That's
correct.
Thank you. Minister, during estimates last week, the Treasurer and the Minister for Housing and Construction said your government would only manage around 455 homes against the 25-26 and 26-27 under the Remote Housing Agreement against a target of 540. What conversations have you had with the federal government in relation to the failure to meet these agreed targets?
Yeah. There is an aspirational target, I would say, under the 10-year program of up to 2,700 homes. So
when you're in opposition.
So when it comes to the aspirational target of up to 2,700, I should say, what I would say is that at the moment we are on target when it comes to the number of bedrooms being delivered.
Bedrooms as opposed to homes?
And I'll just ask, I'll get the CE to expand a bit further on that for you.
Thank you, Member for Nightcliff. As you may know, the primary objective of the remote housing package, including the federal funding agreement schedule and the partnership agreement with the 4 land councils and Aboriginal Housing NT, as well as the Commonwealth Government, the primary objective is halving overcrowding by 2034. There is an indicative and aspirational up to 2,700 output mentioned in the Federal Financing Agreement schedule, but the focus remains on halving overcrowding, which is why we allocate with the Joint Steering Committee where the houses will be built based on rates of overcrowding. One of the things that has happened over the course of the agreement, in our desire and our commitment to listen to communities and work in partnership, is that through housing reference groups and other channels, communities have asked us to build larger houses. So the 2,700 aspirational target was based on an assumption of 3-bedroom houses. On average, we are currently building 3.8-bedroom houses. So whilst the number of houses is lower than what we would need to build to track over 10 years to the aspirational notional output target of 2,700, we are within 10% of that annual build rate when you think about bedrooms, which is what counts for overcrowding, which is the objective of the agreement. And I'm happy to go into detail about numbers if you...
So Minister, on that, the agreement is around houses, not bedrooms. Are we rescoping the agreement to count bedrooms as the indicator?
Look, the agreement itself is it's about overcrowding, and I think we can talk about homes, we can talk about 3-bedroom homes, we can talk about bedrooms, the number of bedrooms per house, but essentially the whole program is designed to reduce overcrowding, and if it means building bigger homes than the aspirational target of 2,700 homes is on the basis of a 3-bedroom home. What we are doing at the moment is working with people living in remote areas, and if building includes building larger homes with more bedrooms, then obviously that is contributing to the reduction in overcrowding in remote areas.
Thank you, Minister. Can you confirm that under the terms of the remote housing agreement, land servicing is to be funded by the NT government and not to be taken out of funds specifically to build new houses?
What I would say is that when it comes to land servicing, when it comes to land servicing, what I would say is that legacy funding for land servicing under previous arrangements has now been fully committed. So delivering new homes under the FFA requires a sustained, reliable and cost-effective pipeline of serviced and developed land. When it comes to certainly our understanding of the agreement is that and particularly through negotiation and implementation, it includes the costs necessary to deliver the program's intended housing outcomes in remote communities. Now, this includes land servicing and program management.
So, and you did flag that in your opening address. So does that mean the NT portion is not going to go towards homes, that'll go towards land servicing?
Sorry, the agreement is a $4 billion joint funding agreement. It's clear to me that land servicing, you can't build homes without land. I'm not sure why anyone would think that, but land servicing and program management is part of the deal. So look, I've had ongoing conversations with the Federal Minister about that, and I'm continuing to have those conversations with the Federal Minister in regard to land servicing and land development. But it's one of those things that's under discussion. You can't build a home without service land, and that's the current issue at the moment.
So, Minister, it sounds to me like we're going to build less homes as a result of that. How much funding are you going to take out and allocate towards land surfacing as opposed to home builds?
Well, as I said, these are the matters that are under discussion at the moment. It seems to me that quite clearly the agreement was signed back in July 24. So I think quite clearly there's still some areas that are being discussed under the agreement, but it's quite clear to me that Labor signed this agreement back in July 2024, it seems that they were more focused on headlines rather than the head work. So this is just one of the problems that we've come across when Labor signing agreements on the eve of an election. It was all about headlines. It wasn't about dealing with the real issues, which is the head work. So,
how much land servicing did Best Price do? Nothing.
So we're working through that with the federal government, but quite clearly it has been, it's the way the program has always worked, and our focus is on continuing to deliver. And if that involves land servicing and program management, of course that needs to come out of the $4 billion.
Thanks, Minister. Has any funding for remote housing repairs and maintenance been redirected to public housing in regional centres?
No, it depends. As I said before, some of the town camps, for example, come under that remote program. So certainly there's some detail around what comes under that remote program. There's certainly been no funding directed to anything outside of that program.
Thanks, Minister. In terms of Homeland funding, why have Homeland Service provider contracts been cut from 3 years to 1 year?
Let me get the detail on that for you. So the issue with that is that the federal funding agreement runs out on the 30th of June 2027. So what we have when it comes to funding for homelands, with that federal funding agreement expiring in June 2027, at the moment there's no commitment from the federal government to contribute towards homelands beyond that date. So whilst we're committing our part of the agreement, there is nothing being committed by the Commonwealth, and this is important when it comes to establishing agreements with service providers. We need certainty. The Commonwealth hasn't given us that certainty, and therefore we can't give that certainty to service providers. So I would urge the Commonwealth to come to the table, make some decisions when it comes to ongoing funding for homelands, because as it stands at the moment, there is no commitment beyond June 2027.
Yeah, Member for Johnston, you've got a follow-up question?
Thank you. Yes, on behalf of the member for Mooka, in relation to homelands, Minister, written question 197 from the 17th of February 26 has not yet been answered. Could you advise what funding has been provided to homelands by the NTG, excluding Commonwealth funding, for the financial years 2021, 21-22, 22-23, 23-24, 24-25, and what is budgeted for this coming financial year?
Just noting that questions are for this reporting period. I'm not sure that the department will be able to answer all of that data.
Oh, sorry.
Thank you, Member for Johnson. In answer to the member for Mulca's question, on average, the Northern Territory Government commits $40 million per year to that program.
And what's budgeted for this coming year?
The current budget is $44.860 million. So.
Thank you. A second question from the member for Mooka in relation to homelands funding. Given the enormous increase in costs that homeland communities have experienced in the past 5 years, particularly in relation to rising fuel and construction costs, will CPI be applied to the 26-27 homeland funding to ensure the real value of the funding is maintained?
Thank you. Certainly this is an ongoing issue that we need to continue to look at when it comes to that, but the reality is at the moment that we've increased, the revised budget for 25-26 was $38,381. We've now increased that to $44,000 44 million, I should say, 44 million, 44, yes, $44,860. So there has been around about a $6 million increase to take into effect the increase in costs.
Thank you, Minister. And just a couple more questions from the member for Mauka. This is in relation to remote housing, so let me know if you're happy to answer it against the opening statement. On behalf of the member for Mauka, in the Mauka region, please advise who sits on the housing reference groups for Milingimbi, Ramangini, Ngulawinku, Yirrkala and Gunyara. Thank you.
We would have to take that on notice. I don't have the lists of membership of the housing reference groups for every community, but we can certainly get that information for him.
Thank you.
Member for Johnston, could you please restate the question on behalf of the member for Mauka for the record?
On behalf of the member for Mauka, in the Mauka region, please advise who sits on the housing reference group for Milingimbi, Ramangini, Ngulawinku, Yirrkala and Gunyara. Thank you.
Minister, do you accept the question?
Yes.
The member from the question from the member for Mauka, I'm going to say, has to the minister has been allocated the number 5.34.
And one
Member
more
for
question.
Johnston?
Thank you. On behalf of the member for Mauka, is the department aware that the current rollout of new subdivisions in remote communities often mixes clans together rather than previous arrangements that group family clans together in one area, and that this creates ongoing tensions within communities, and what is being done to address these concerns?
Look, the short answer is this is why we have housing reference groups to work through the establishment of subdivisions, but the allocation of housing in communities. Our tenancy staff visit the communities, meet with the housing reference group to talk through these very issues. So when it comes to tenancy allocations and planning around those, this is a shared decision-making arrangement, and we're out there working directly with the housing reference groups to work through those very issues at the local reference group. They're best placed to understand the very issues that you raise because they're on the ground in the community. So we're out there listening and working with the housing reference groups to ensure we do our very best to get that right.
Thank you. And just one more question on my behalf while I've got the mic through the chair. Minister, what standard does NT Housing use to determine whether a public housing dwelling is safe and habitable in extreme heat conditions?
Thank you for that question. What I can say is that all new housing meets the National Construction Code requirements, which is a minimum 5-star energy rating. In 25-26, new builds averaged a 6.9 star, with some exceeding 8.8 stars in tropical regions. The department is improving thermal comfort through targeted air conditioning upgrades, replacements and ongoing maintenance. So yes, all new housing builds meet the National Construction Code requirements with a minimum 5-star energy rating.
Thank you. And is the department conducting any audit on existing housing in relation to heat resilience?
Look, at the moment, there's obviously quite a significant number of ageing stock right across the Northern Territory, both urban and remote. Some of the things that we are targeting through is targeted air conditioning upgrades, replacements and ongoing maintenance. For example, in Central Australia and the Barkly, we've allocated $6.2 million for 26-27 for air conditioning upgrades. This funding will support installation of new and replacement units alongside ongoing servicing through maintenance programs.
Final question. Minister, what proportion of the public housing portfolio is considered vulnerable to future climate risk? But both heat, and we've heard a lot about what's happened over the last period of time, extreme heat, flooding, cyclones and sea level rises.
We haven't done that assessment.
Thank you, Minister.
Member for Johnston, are you continuing? We've got the Shadow Minister still wanting to ask questions. I just had a follow-up to that specific question. Last one.
In that case, Minister, my question would be, how is the department ensuring that housing built today remains fit for purpose over the next 30 years?
As I said before, all new housing is built to to the National Construction Code requirements. So all new builds being delivered under the housing programs and are under the National Construction Code requirements, which is a minimum 5-star rating. And without going into detail again, 25-26 there were new builds that averaged 6.9 stars, with some exceeding 8.8 stars in tropical areas. Some of the future initiatives expected will include improved insulation, thermal coatings to roofs and walls, and also broader energy efficiency upgrades.
So just one little clarification. I might have missed it in terms of the member for Mooka's question about Homelands funding. I think you said 44 into the next.
Yes, that's right. 44.
What was it for this most recent year?
I think it was 38, but I can get that detail. I think I said the increase was from 38 to 44 million, roughly.
Thank you.
Member for Nightcliff.
Minister, in terms of Indigenous essential services, what is it currently costing to run diesel-dependent power to remote communities?
Look, we don't have that information. It's probably more a question for the Power and Water Corporation, who maintain those fuel levels in. Yeah. But obviously, when it comes to cost, we've seen a lot of fluctuation in diesel costs at the moment. So Power and Water may be able to put a figure on how much it's cost to, 31 March, but that's probably a question for Power and Water. But what I can say is that through I suppose through general government, we want to make sure that fuel stocks are up as high as they possibly can be in remote areas at the moment. But costs, that's going to range quite broadly at the moment.
Have you got a number there, Minister?
We don't have an actual cost. That'll be a matter for Power and Water.
Okay, thanks, Minister. In terms of local government, can you point to funding in the budget to meet your election commitment around de-amalgamating councils?
Oh, look, what I've said in regard to when it comes to de-amalgamation, what I said in my opening statement is that we're out having quite substantial conversations. I think what I did quote in my opening statement was that we have, at the moment, as of 24th of April 2026, we've engaged with roughly 210 traditional owners, residents and community members, along with the Barclay
Chair,
Aboriginal.
on relevancy, I'm asking about funding, not consultation.
It's particularly relevant to your question, because what I'm getting at is that we're at the consultation stage, and if you're looking for money in the budget, you're totally on the wrong track, because what I have said is that we're out there consulting with people. When it comes to the crunch time, if the people in those areas want to make changes in the areas, because we're working together with people, this is something it's not being forced upon people. It's not the same as the 1st of July 2008, when the Labor government absolutely scrapped every local community government council. This is a different process. We don't do what Labor did. we're out there talking to people about what it looks like when it comes to real local decision making in communities. So what we're doing is having those conversations with communities about the best pathway forward for local people living in those communities, because what's happened over the last 18 years is that they've become totally disenfranchised by a Labor decision on the 1st of July 2008 to scrap those local
That you mob
community
kept when
government
you were in
councils.
government.
So what we are doing is getting out and talking to people, working through the issues that Labor left behind, and
That
when we
you
get to the
kept.
and when we get to the
Gordger,
stage
this
of
is not your
making
line of
change,
questioning.
I'll be the first one to let you know what the budget is.
Thank you, Minister.
Madam Chair, I have a follow-up
you-
on the de-amalgamation of councils.
he's still
I'm still going.
I have a follow-up
So in
question.
terms
We'll
of
just let the member for Blaine do a follow-up question on that question. Thank you, member for Blaine.
So I'll try to keep it brief. This is on de-amalgamation of councils. This is a question from the member for Fong Lim. Can you please update the residents of Northcrest on where we are at with the incorporation of Northcrest into a local government area?
The short answer to Northcrest is that we have written to 3 councils, being the City of Darwin, the City of Palmerston, and also the Litchfield Council. The department has received submissions from all 3 of those councils. That information is currently being collated by the department, and once that information comes to my office, I'll be making a final decision on whether Northcrest should be incorporated into a council area.
Thank you, member for Nycliffe.
Thank you, Chair. In terms of those consultations that you were outlining before, Minister, can you give us any outcomes or feedback from those consultations you've had to date?
The feedback is that people want stronger representation, they want better service delivery, and they are considering what de-amalgamation options would be best suited for their community. The feedback that I receive every time I go there, including feedback given to the department, is that there's people out there that are still absolutely furious with that Labor decision on the 1st of July 2008 to scrap community government councils in those communities. People feel that they can no longer participate in decisions in their communities. They feel that services have been taken away from their communities. They no longer feel that they can participate in decision makings at the community level in their communities. Services have disappeared, jobs have disappeared, local decision making has disappeared, and as I always say, what really happened on the 1st of July 2008 is that you scrapped your team, your Labor team,
Wasn't me,
Labor
Minister.
team,
I was not in
your
government
Labor
then.
team
I was not in government.
Everybody
every
just
option
relax.
for local leadership in those
And
communities.
Best Price didn't do any
what,
better.
Member for
What
Gordger.
disappeared on the 1st of July 2008 was that leadership structure in every community. The Labor government took that away. These are the things that people in the bush are talking about, and they've been talking about it for the last 18 years, and that's why we're taking action.
So what's the action you're going to take out of that consultation, Minister?
We're consulting with people. I don't know how many times I have to remind you. We're working with the people to look at a pathway forward.
Thank you. Minister, have you costed the impact of the removal of power subsidies on local councils?
That's a question for Treasury or Jacana.
So have you received feedback from local government sector and councils about the impact of that change?
There has been some feedback provided. I was recently at a Legant meeting and I believe Treasury addressed the Legant meeting on that day.
So are you aware that some councils might have that subsidy reinstated or continued and some are not?
Sorry, what subsidy reinstated?
That power subsidy. I believe some councils are going to be able to retain that power subsidy and some are not.
Look, what I am aware of is I'm aware that the Treasurer has written to some councils to assist in providing, well, has offered to provide some grants to assist in managing that those power increases.
Can you outline what criteria was used to evaluate which councils will get that and which ones wouldn't?
That's a matter for Treasury.
Can you explain what the biggest power price rise is out of all the councils?
I don't have that information. That's a question you should have asked Treasury.
As the local government minister, that you haven't received that feedback or information from the Treasurer?
Let me just check. Look, Treasury has provided information. They've recently written to those councils that are affected, offering some grants to assist to manage those increases. I don't have that information in front of me.
Member for Gwadja?
Thank you. Minister, could you just confirm, you're talking about de-amalgamation and then you've talked about empowering the bush. Are they the same thing or are they two separate things? And if so, how much of the budget has been allocated to your project empowering the bush?
I've answered that question.
Well, you haven't. You want to answer it again?
I've answered the question. I've told you.
So clarification, can you confirm through the chair,
let me read this
is
once more.
empowering the bush de-amalgamating?
Member for Gwadja, if you keep talking over people in here, I will put you on a warning.
Well, I wasn't. I was.
No,
The room was quiet.
You were.
Well, who was talking?
If I recall, and I can see clearly, your sign does not say chair, mine does. Please stop talking
didn't hear
directly
you
to the
talking.
minister and come through the chair. I think you've got some good hearing, so you did hear me
All right, well,
speaking.
let me talk
Please
then.
direct your questions. You've already asked a question. Let the minister answer. Thank you.
A point of order, Madam Chair.
At least let the minister
Well, he's
answer the
looking
question.
at me, so I'm assuming
Member
he's...
for Gwadja, let the minister answer.
Look, thank you for that question, Member for Gwadja.
Oh, you're welcome.
When it comes to empowering the bush, look, I said it in my opening statement, this is about shifting from top-down decision-making to a stronger local voice. Stronger local governments are more place-based development. So I suppose there's a number of aspects to empowering the bush, and through our community development role and through local government, the main focus at the moment is getting out there and talking to people, and that's I've made that point a number of times. We're not forcing anything upon anybody. That's what Labor does. They did that on the 1st of July 2008. They scrapped every community government council. They forced people
Point
into
of order,
shire
Madam
councils
Speaker.
back then.
Member for Gwadja?
And,
I'm again the particular question. I want to know how many people in the department are in the Empowering the Bush division to do this work the minister's talking about.
This is a new question.
Through the chair, I'm being interrupted.
Thank you for the new question.
I'm just being interrupted
Just
again.
quickly, this is a new line of questioning.
No,
That
it's
was
the
not
same.
the question.
It's empowering the bush, and I'm wanting
Member
to
for
know
Gwadja?
how many people are in the division.
Member for Gwadja, that was a new line of questioning. He was answering your previous
let
one.
me-
You said point of order about something that you hadn't asked. So
No, I'm asking
please,
point of order because
clarity.
I'm not interested in what happened in 2008.
matter,
We were
he's
all
answering
here.
the
We all
question.
know what happened.
Member for Gwadja, let
Clearly
the
it's
minister
touchy
finish your
subject
first
for
initial
him.
questioning, please.
So, look, empowering the bush, as I said, it goes hand in hand with community development. Look, overall in the department, I think there's roughly about 100 people working on community development. But when it comes to empowering the bush, it could involve de-amalgamation. There are some people that want to see new local government councils established in their communities. We also have 20 existing LDMs, local decision making. This is something that for some reason the opposition has been telling people that we've scrapped these 20 local decision making agreements. And look, what I want to put on the record is that we haven't scrapped anything. There are 20 local decision making agreements, and despite what Labor says, they haven't been scrapped. We're working through the local decision making agreements, and this is part of around empowering the bush. So through whether it's de-amalgamation, whether it's working through LDMs, whether it's working through the NT Rye money, that 842, I think, over 6 years. There's a whole range of remote money that I think we're waiting for from the federal government. But empowering the bush is a big agenda. There's roughly about 100 people working on it. We'll continue to engage with people because there's some communities that want to see their local government council returned. There's communities that have never had a local government council, such as Canteen Creek in my electorate. They just want to improve the level of services, increase community development in their region. They want services to come back to their community, which were taken away some time ago, and that might involve tenancy, housing, repairs and maintenance. It might involve sports and rec programs, but there's a whole range of services that communities themselves want to deliver locally rather than having a drive-in, drive-out service, which has become the result of scrapping community government councils back in July 2008. So it's a very broad program, and we'll continue to engage with people living in the bush.
Thank you. Through the chair, it is disappointing you couldn't empower the bush when you were the mayor, but are you able to confirm if the LDMs will have the opportunity to be renewed, or upon their contract agreement expiring, is that it? Are they just then completed?
Yeah. Well, firstly, when I was the mayor, I did empower the bush.
It's not what they said.
So, well, when I was the mayor, we established a Barkly regional deal. I know you've got
one you criticised.
I know you've got a very short memory, but there are things that you conveniently forget. So, empowering the bush in the Barkly was an extremely big process. It's an agreement which is signed by 3 tiers of government, being the local government, being the NT government, and the Commonwealth government. So yes, I can disagree with you around that. Yes, we did empower the bush through a Barkly regional deal, and that's a social, economic and cultural place-based community agreement, something that Labor never did. In fact, we had to drag Labor kicking and screaming to the table.
Point of order, Standing Order 110. This was about the LDMs able to be renewed or once they expire. I'm just clarifying because you haven't answered that part of the question.
You told me I didn't empower the bush.
Well, I'm
just getting everybody to just take a step for a minute. Member for Guadja, you're jumping from question to question.
No, it's the same question.
No, with your standing orders, you ask a question and you come back with a standing
but
about
I'm just
another
getting
question. Can you just be quiet for a
relevance point
second?
on this.
Just 1 second. You're jumping from one to another. Keep your line of questioning. Allow the minister to answer. Come back and ask another question. Don't jump in with points of order.
Yeah.
Please, and direct your questions through the chair.
Point of order, Madam Speaker. That was the actual part. The part was in 2 parts. The first part was about the mayor, and then the second part was actually about will the government enable the renewal for local decision-making agreements, or will they simply expire and then that's it? So I'm asking for the question.
I don't know about anybody else, but I didn't hear that second part.
Well, you need
Minister,
to check the hands.
The floor is yours for the next 2
I'm
minutes.
answering the question about the allegation put forward today that I didn't empower the bush. I've just made it clear that I did my bit when I was the mayor. Sadly, as I said, Labor were dragged kicking and screaming to the table. Yes, they did eventually put some money on the table. What I would say in regard to the local decision-making agreements, already Groot has transitioned to a regional council. The Groot Archipelago Regional Council has, we've delivered that. Our government delivered the new regional council by over at the Groot Archipelago. So that local decision-making agreement is being worked on, and I must say that there's probably a number of other local decision-making agreements. I think 7 of those communities have already told us that their preference would be to see de-amalgamation of councils. So through those consultations, we are working through all of those. But in regard to conversations about those local decision-making agreements, they're ongoing. We're delivering them.
Thank you, Minister. Just
through the chair.
It is 3 o'clock. We will take a break now for 30 minutes.
It's in the session.
Sorry? Oh, the end of housing. Yes, sorry.
We only have 30 minutes left, Chair.
It is 3 o'clock.
We finished.
Timing is...
Chair.
Sorry, just 1 moment. I'm just going to clarify times. Yeah, okay. We are out of time.
I'll follow up to an earlier line of questioning. Can I just get them to take a question on notice?
Well, you can just put it on notice.
Yeah, you can just put it on notice separately. You don't need to do it through this process. I will wind up. That concludes our hearing output for today for Department of Housing, Local Government and Community Development. On behalf of the committee, I would like to thank you and the agency officers that attended today to provide advice to the Minister. The committee will proceed to NT Home Ownership Business Line. No, sorry, I'm confused. We will now take a short break and resume at 3:30 with questions from the Minister for Lands, Planning and Environment. Minister, would you like to say anything from your department's perspective?
Look, gee, time flies when you're having fun, doesn't it? Look, in closing, thank you, Chair. I really do want to put on the record, thanks to the team from Housing, Local Government and Community Development, the work that's gone underway to prepare for today's estimates has been extraordinary. all of the staff working on the front line have contributed to where we are today. So thank you to every staff member that has contributed, and keep up the good work out there.